Labas rytas visiems.
Good morning, ladies and gentlemen. I apologize those colleagues that are still waiting in line to access the Parliament building, since there are well over 300 people registered for this event, and there are still parallel events taking place in these buildings. Unfortunately, some people are still late for the opening of our event, but they're going to join us soon enough. And so with that, I would like to welcome everyone present here and watching us online, and those that are going to watch the video recording of this conference. And now, to welcome our conference, I would like to give the floor to Dr. Juozas Olekas, Speaker of the Seimo of the Republic of Lithuania.
Ačiū, gerbiamas Sauliau.
Thank you, Saulius. Dear ministers, excellencies, ambassadors, scientists, doctors, experts, participants of this conference, ladies and gentlemen. It is truly a pleasure to welcome you here at the Parliament of the Republic of Lithuania, the Seimas, to discuss an issue topical for the whole of society. I believe that the leadership of politicians is indeed important. And I'm grateful to Professor Čaplinskas, as well as members of the Committee on Health Affairs of the Seimas, for discussing this topic in particular, which is healthy aging and health policies, both of which is a strategic choice for the state. Today we're discussing a topic that is relevant for each and every person, family, and the state. Each and every one of us wants to lead a longer life, and more importantly, we want to make sure that the added years to our lives are healthy, active, and meaningful. Which is why healthy aging is not only an issue for the health system. We're happy to have the Minister of Finance and representatives of other ministries present in today's event, because education, social security, culture, sports, employment, work environment, the communities that we live in, and establish contacts, all of these areas affect each and every one of us. Speaking in formal terms, this topic we're discussing today should be mainstreamed in all the other political fields. Looking at the agenda, I see that healthy aging is what features across all of the keynote speeches today, and this is a strategic choice. Today's conference reminds us that it is not only about health affairs and health systems and healthcare systems. It is about providing the conditions for people to lead longer, healthier, and active life. Let's say for the staff member of the Parliament, those that are 80 years and above, how should they do that? For Lithuania, as well as for many countries around the world, we are dealing with certain demographic changes. And this is something that we feel the effects of which severely. Our birth rates have decreased threefold. Our aging society and the growing average life expectancy contribute to the increased responsibility to provide the conditions for our senior society to stay healthy and active, and to contribute to the growth of our economy, enjoy lives on their own, and reduce the burden in case they encounter any health difficulties. Seeing so many experts from all walks of life and the different countries present here, I realized that a lot of attention will be focused on prevention and science and innovation, on international cooperation and exchange of best practices. That is exactly how new ideas are being born, those that can later become actual solutions translated into legislation or legislative amendments adopted here in the Parliament. So I wish you an open, creative discussion and one that is geared towards practical solutions as to what could be done. I believe that all of that will help everyone to achieve better awareness and understanding that investment, and I address this to our Minister of Finance, investment into our society will also contribute to investment into our economic growth. So I hope that at the end of our discussions, we will be able to receive solutions that would be implemented in practice, and I hope that your voice will be heard, the voice of Lithuania, the voice of Vilnius will be heard across these discussions focused on healthy aging and healthy living. I wish you successful work in today's event and a successful conference. Thank you.
Gerbiamas pirmininkas.
Thank you, Mr. Speaker. It's a pleasure that we can also welcome a representative of the World Health Organization in today's event. So hopefully that the things that we're going to discuss today, the proposals, the suggestions that we're going to hear today, will be referred to a broader community beyond our borders. So now the floor to Mr. Yong Ji-yong.
Yeah, so we are very pleased that you are here. So please, floor is yours.
Thank you so much. Rapatas, Gerabe Daliche, Mandida.
Thank you.
Your Excellencies, Ministers, Vice Ministers, Members of Parliament, distinguished colleagues, ladies and gentlemen. On behalf of Dr. Hans Kluger, the WHO Regional Director for Europe, it is my pleasure to join you today in the Seimas of the Republic of Lithuania. So let me begin with a simple observation. Everyone in this room is aging. Every family is touched by aging. And every community is shaped by aging. Healthy aging concerns all of us. And it's not simply a health issue, or social or economic, it is a societal issue. Yet we rarely talk about aging in this way. Too often, aging is discussed and perceived as a challenge, to be managed rather than to be celebrated as an achievement. Longer lives are one of humanity's greatest achievements. So when we discuss healthy aging, we often talk about older people. In fact, we do, but not only. We are discussing and talking today's workers, today's parents, today's students, and future generations. Because healthy aging begins long before older age. And it begins with opportunities that we create, the environment we build, and the investments we make throughout people's life. So today, almost a third of Lithuanians' population is age 60 and over. And across the European region, people are living longer than ever before. And for many years, we measure our success largely by looking at how long people have lived. And that remains very important, but it's no longer enough. Today, how do we measure success? What we must measure is whether those extra years are spent in good health, with dignity, with purpose, independence, and social connections. In other words, not simply adding years to life, but life to years. Now, population aging is inevitable, but healthy aging, now that's a choice. One is driven by demography. The other is decision made by individuals, by government, by communities, and by society. And so this is exactly the thinking behind the WHO upcoming new strategy on healthy aging that we call Aging is Living. It is a strategy to promote a lifetime of health and well-being, from which our 53 member states will consider adoptions later this year. And it focuses on 4 key policy strategic directions. First, preventions and health promotion. Transforming health and care system. Third, creating age-friendly environment. And finally, challenging ageism. Together, these actions recognize that healthy aging is not the responsibility of any one sector, because prevention requires education, employment, and supportive communities. Care requires coordinations across health, social protections, and labor. Age-friendly environments depends on housing, transport, culture, and local government. And challenging ageism, that requires a shift in how we as society view aging and how we view older persons. And that is why it is so encouraging to see parliamentarians, ministers, vice ministers from finance, education, social security, labor, culture, and health gather here today. Thank you so much for your leadership and your commitment. Healthy aging is not a sectoral action. It is a strategic choice for the state. And so the strategy from WHO Europe provide a roadmap for actions for Lithuania across the Baltic regions and throughout the European region. But ultimately, the success is not determined by what it is written on the paper, but success is determined by our collective decision that we made today. The decision we made today will shape how we age, but how future generations will age as well, because healthy aging is not about someone else, it is about all of us. So thank you. Globėjas ačiū.
Thank you so much. And you provide clear examples that even during one night, so how many Lithuanian words you can learn and so on. I only can imagine what would be if you stay there a little bit longer. And in any case, we would like to especially to thank you, to thank WHO and Lithuania. All of us will be a good member of World Health Organization, and we appreciate collaboration together. So now, dabar džiaugiuosi perdodamas moderatorių.
I would like to invite Ms. Laura Dabulytė to moderate today's conference. I would like to talk about new words. Our guest can speak Lithuanian, and it took him a while to learn it, but last year I didn't know about healthy aging, and I would like to praise the organizers for not using the word longevity, but we're talking about healthy aging. And we're talking not about the current generation, not about those Lithuanians who are over 60 years old. We're talking about our future generations. And we have 30 minutes for this discussion, and I would like to start with a topic that's relevant for every ministry, and we have Mr. Kristupas Vaitiekūnas, Minister of Finance. What are we going to do in this area in our country? Thank you for the floor. Yes, health is one of our priorities, although we live in difficult geopolitical times, so we have also other priorities. But healthy aging is a priority not only because it is related to the economy, to finances. The demography of all Western countries is concerning, and Lithuania is no exception. And the number of aging people, when people are healthy and included, it supports our economy, our finances, and people who remain active, they can enjoy good quality of life. But we understand that it's impossible to achieve without funding. We need to allocate more finances for healthcare. And in the future, with advancements in medicines and with the growth in our economy, healthy aging will be more accessible and more people will feel what it is. As far as I'm concerned, healthy lifespan in Lithuania is rather short. However, I believe that with time we will achieve more healthy aging in our country. Can you give us a certain number as a Minister of Finance? Can you give us a number that would indicate that this topic is a priority in our country? We can talk about the increasing funding of healthcare, and the increase is rather rapid. But as far as I'm concerned, the financing for healthcare sector increases by 8 to 10% every year. We're also going to talk about social care, culture, and many other areas. Now I would like to give the floor to Ms. Deimantė Bukeikaitė, Vice Minister of Social Security and Labor. Could you please talk about the demographic situation of our country? Good morning. The demographic situation in our country is rather clear. We are aware of it, and it's quite concerning. We have lowering birth rates while our society is aging, and it is estimated that by 2050, 1/3 of our society will be age 65 or older. So we do have demographic challenges in our society because of the aging society. We don't have high birth rates, but we have to be thankful for the already existing birth rates. But the situation is such that our policy is oriented towards strengthening family policy, and the government has a plan to continue on this policy. We're analyzing our demographic situation and shaping our policy according to it. Because aging and demographic issues have to do with all areas of policy horizontally. And what about the feeling of loneliness that is experienced by older people? We shouldn't be left alone without our families. People need other people, especially when our social security, our ability to work, are decreased, and it is concerning. And our ministry focuses on older people, and we carried out a state audit on loneliness, which showed that almost 35 older people in our society experience loneliness, and out of them, 87% are not asking for help. So we are raising the question why people don't ask for help. So we as a ministry, together with municipalities, are trying to answer these questions. Maybe people are not aware of the possibilities to receive help. If there's no family, maybe it could be a community that could support lonely people. The Speaker of the Seimas invited people who are 80 years or older to work here at the Seimas. Yes, of course, we need to have a clear vision that 80 years old is not old. Look at Mr. Antanas Vinkus. He's always here in the Seimas. So we need to think that 1/3 of our society is 65 years old or older, and we need to increase the number of our young people, because in 1990s the birth rate would be 60,000 births per year. And we need to focus on employment. Our minister said that we should organize discos and other forms of entertainment for people. What are we going to do when we are 60? We will be active, we will do sports, we will work, we will take care of our children and our grandchildren, we will study, we will travel, we will participate in community activities, and we will be involving other peoples. We will try to encourage all of that and to ensure that our aging is a positive experience and not a lonely one. And when it comes to the labor market, yes, we do have challenges. In 2022, people who were 65 or older, around 21,000 of them were in the labor market. Well, currently, there are more people over 65 working. And it has to do with our horizontal policies, how to tackle the number of aging people and how we are involving them in our society. I think the European Union also has to do with it. Next year, we are holding the presidency of the Council of the European Union. What do you see that's coming from Brussels? Do we contribute to what's offered by the European Union? What are we doing to prevent burnout? We know that the various directives by the European Union and decisions come to our national laws. And in the current government program, we have provisions geared towards the social security by the employees, by improving work conditions. And finally, what I'd like to mention when it comes to our ministry, currently our state has decided on the law that would define the policy regarding the aging society, and it's already there in the Seimas, and it shows that our state prioritizes the issue of the aging society, and that our state understand that it is a national question, and I hope that this law will allow to coordinate our work in terms of this policy.
Is there anything new? Well, yes, we will have a lot of new things. We will have a program for the seniors, but there will be also a program that provides for specific commitments for the different ministries, and this will be all put down into a law. Well, it's great to hear all of that. And when you mentioned those numbers, say 90,000 seniors that will be seen in some years to come that we will have to take care of, I wonder how our model is working in from other countries' perspectives. So it seems that for a small country such as ours, our model is quite effective. Now, I would like to go back to the field of culture, and we do have Renata Kurmin, the Vice Minister of Culture. Renata, I know that you are working with serious things, and whenever you mention the word disco, something that would be used to increase the activity of seniors, the topic eventually becomes the main focus of debate. So I wonder what you are going to focus in the future. Well, thank you, Your Excellency, ladies and gentlemen. Thank you for the invitation. Let me just say that the Ministry of Culture abides by the principle of the accessibility of culture, something that is also enshrined in our law on the fundamentals of culture in our state. When implementing our cultural strategy at the state level, we're trying to ensure cultural diversity and availability of cultural services for our residents, including our seniors. The scope of these services is quite vast, and they're being provided by the institutions that are closest to the people. As it has been mentioned, people are yearning for people. And so our institutions, such as libraries, museums, cultural centers, all of them are engaged in a number of different programs focused on our seniors. Perhaps too little awareness of those programs is being made. So we should focus not only on the set discos, but also on programs such as educational programs at museums, guided tours. This is something that the seniors mostly opt for, but not all of the museums provide these services, and this contributes to the variety of services available for the seniors, making sure that they are able to get involved in the programs that are specifically designed for the seniors. The libraries can also offer a wide spectrum of different programs, including the reading of books on site or lending of books. We also have a program such as a book coming to your house, a very popular book when books are being delivered to people's homes. We also have computer literacy programs available in our libraries, programs teaching our seniors how to make use of digital services, how to operate online. We also pay a great deal of attention on media literacy, the use of AI. Renata, if I may interrupt, as far as I understand, all of these instruments that you are identifying, these are tools that are widely accepted by our seniors. Yes, indeed. So as far as I understand, this is how you are adding years to life and life to years, right? As mentioned in the beginning. Yes, that's how we're trying to do that. Well, thank you then. We also have Mr. Kęstutis Bartuškevičius, advisor to the Ministry of Education, Science and Sport with us. So what are we going to do? How we're going to get involved in sports, education and science? All of us as members of society can get together and act together. So what can you say in your part? What could we do together? Yes, I'm grateful to the organizers for having the opportunity to speak about health in one place. To the Minister of Finance, I would like to say that the funds allocated for healthcare could be redistributed in a way so that our ministry receives more of these funds. Well, there we go. Well, of course, this is just me being a little sarcastic, but our ministry, the Ministry of Education, Science and Sport, is trying to change the mentality of our people, because up until now, physical activity and focus on healthy lifestyle was something that was left on the margins, and it was up to the people on their own to find their way. So our ministry follows a vision where our children, starting from school, could become more aware of healthy lifestyles and have the opportunity to improve their physical activity. And we would like to encourage our children as more as possible to spend more actively their free times. You know, I love to speak with examples. There was one person I met at a sports stadium with when I was there with my daughter during some very bad weather, and I was asked what we were doing there. Well, I was surprised by the question, because yes, indeed, we can watch a sports game there, but we can also enjoy active leisure time there as well. So active physical activity and activeness in general is a part of our ministry's mission. As for our seniors, we also have a program for healthy lifestyles of our seniors, a topic that is also quite important among the elderly, because it empowers them to be members of society, avoid the sense of loneliness, and make themselves useful in the labor market. At the moment, we're also discussing that a program called Kursuok is looking to seeking changes whereby people aged 65 and above are able to engage in training and upskilling based on their professions. I'm very happy with the content of this event and with the keynote speakers that are going to take place here, because it shows that we're finally trying to understand that healthcare is a cross-sectoral issue, and even a matter for the Ministry of Transport and Communication, because it is in charge of laying cycling paths across the city, which encourages people to seek a more active lifestyle. So once again, thank you to the organizers of this event. Thank you, Kęstutis. Does that mean, and we have Laimutė from the Ministry of Healthcare, does that mean that you're going to take up more activities in the field? Well, just a tiny secret, if I may.
Labai privati vieta sakyti paslaptis.
Žinot, kaip ten sako.
Well, it's not going to be a secret since you'll find out about it. But our minister and Minister Popovienė and other ministers, we are looking for ways how to promote physical activity, the activities of health officers, and I believe we can find positive directions. We're looking forward for that. Our society is changing. It's been 5 years since we are different, and Ms. Vaidalienė is next to me. You don't have a lot of time for your remarks, but this is Vice Minister, the Vice Minister of Health. Can you elaborate on what Mr. Bartuševičius said, that we want to be healthy and back in the day people would be aging quicker, and now we are now more curious and willing to preserve our health. Good morning. I'd like to begin by saying that I'm glad that we are talking about all areas, not only healthcare. Yes, we are doing a lot. We have a lot of activities, but without the inclusion of other areas, without cooperation, we cannot achieve our goals. And I'm pleased that other ministries are involved, and we have a lot of joint projects. We spoke with Ms. Bukeikaitė, Vice Minister of Social Security and Labor. We are finalizing long-term care services package. And of course, we want to be healthy, and it's natural, but I would like to talk not only about the prevention programs, and we have great prevention programs, but it's unfortunately that not everyone is participating in that, and those programs are focusing on a variety of diseases, and people could take care of their health very easily, but only half patients show up for those prevention programs. And one thing is to talk about it, but the other thing is to do it. I think Kęstutis is going to do something about it. But we should start with the person's childhood. And when we talk about healthy aging, we need to talk about our children. And I'm glad to see people doing sports with their children, because only when we take care of our children properly, we can expect them to take care of us one day. In Lithuania, the number of working people will have to be sufficient to support those who won't be able to work. 80% of our population who are age 65 plus have certain chronic diseases. Is it a problem of Europe? I don't have the statistics right now, but our healthy life expectancy is lower than the European average, especially when it comes to men. So there's room for improvement. And I'm pleased that all ministries are talking about it. Mr. Olekas, yes, I agree. Practical healthcare measures are important, and we need to remove the ceiling for certain prevention programs in order to attract more people. And since we're focusing on healthy aging, some more older people could be given the opportunity to participate in prevention programs, and this is my idea. I would like to thank our panelists. We can, of course, continue this discussion. I would like to thank you. We will be watching you. Thank you, Laura. And we thank the participants of the discussion. Now I would like to ask you to take your seats in the first row. Before the coffee break, we will be taking a family photo, and without further ado, let's move from the introduction to specific presentations in order to learn from each other, to learn from each other's experiences. And first of all, I would like to give the floor for three speakers who are going to talk about strategic measures. First of all, Dr. Malina Miller.
For coming, and general request for all speakers. As you see, we are trying to be more or less on time. So please, for everyone, make short introduction, what you think would be most important. We all would like to know about you. And then just general message you would like to present, and what kind of take-home message. And please remember that time is really limited. If 10 minutes, so it means 10 minutes, not 11. Less could be. So, Malina, thank you very much for coming. It's a really great pleasure and honor to have you here. So.
Yeah, thank you also very much for the introduction and the invite. And I am not as talented as you, Yongjing, with language, so I cannot compete, but I can say that last year I spent my summer vacation here, and I enjoyed the lakes and the sauna, and maybe I can get some credit for that. And as we only have very limited time, 10 minutes for a topic that my heart is linked to, and I could talk for hours, I will make it quick. So my name is Malina Müller. I am from Germany, and I am leading at the research institute, the Health Economics Department. And one main passion of us and me personally is to shift how we view spendings in the area of health. And this is seeing them not solely as a cost driver, but as an investment, something we have heard today already a little bit about. And I want to start with some key figures, why it is important that we shift this paradigm and that we really invest in the area of health. When we look at the Baltic region, then the average spending for healthcare is 25% lower compared to the European average. And this is directly translated to fewer life expectancy and less years of lives in good quality of life. And when we look at how this has developed over the past decades, then we see an increase in years that are spent in poor health. And this is not only because of human rights and because we all want to, let's say, simply be in good quality of life. No, it is also important that we invest to reduce these lives in poor quality of health, because it is the economic foundation of prosperity. And most often, or in the past, and we're unfortunately still there, spendings in the area of health are seen as a cost driver. It is kind of a line item in an Excel view, and the idea is to reduce it. Health expenditure should be limited, and we cannot afford to spend more. And besides that, the discussion around it is very siloed. It most often happens solely in the Ministry of Health. I was really impressed when I saw the agenda that more ministries are here and that there is really the ambition to have this open dialogue, because we in Germany, we do not have such a cross-ministerial dialogue. And I think this is needed if we really want to position health as a key performance indicator of a country, because it is not an output of general prosperity, but really the input that is generating economic growth, that is generating stability, economic resilience, and thus also security, something that is becoming more and more important. And especially in times where we have other challenges, geopolitical challenges that we have to face and that will require that we maybe reallocate budget, we should nevertheless not forget the basis of our economic prosperity. And what I would like to highlight is that the area of health per se is an economic sector. We tend to neglect that, while we think that it is good that we have, for example, an industry like the automotive industry that should be, let's say, positioned and further pushed. We forget that the area of health is also an industry per se. It is generating jobs, economic growth, stability, but what differentiates this sector, this industry, is that besides generating economic output, it is generating health. Again, the basis for our lives. And I said that spendings in the area of health are seen as a cost driver and something that is draining our pocket. But let me take you by the hand and shift the perspective, because what is draining our pocket is the diseases. When we look at the Baltic region, then we see that on average per year, we lose almost 10 billion because of bad health. And for sure, not every disease can be prevented. And you will always see people not being healthy enough to go to work. But when you look at the preventable death, or the equivalent, the monetary equivalent of the productivity losses, we still see a number of 6 billion euros. And these numbers might seem big, and how can you put them into context? But if we look at the let's say, the comparison with the GDP, then you can see that it is 6.4% of the Baltics GDP. So the disease is almost costing us as much as we are spending for area health in the whole national context. So if it would be a sector, then disease would be leading. So do we want to have, let's say, diseases as the front runner of our economy, or do we want to have, let's say, spendings in the area of health generating positive return on that? And what you always have to consider when you see that diseases are costing us a lot of money is that this money cannot be spent for other things. Putting just, let's say, these numbers into context is equals the income of almost 800,000 Baltic families. So a lot of money that is not spent for something else. And it might seem a little bit high or too ambitious to directly close the healthy life years gap compared to the European Union, but just making up a thought experiment. If we would close this gap to having only 2 years, step by step, making realistic targets is also important, then the Baltic region could gain 1 billion euro per year. And this is money that we are kind of, losing on the street because we are not prioritizing right. And we have already heard that it is not about only the people who are already older, but that we also have to invest in our younger generations. And I will not, let's say anything else, but we should not forget that our people who are not working any longer on the labor market, they are also stabilizing our societies. because once they are leaving the labor market, the official labor market, they support us with our childcare, they support other older people with informal care, and so stabilizing the economy as well. And especially in the context of aging societies, where we see at the same time labor shortage and an increase in care demand, this is needed, informal caregiving is needed to kind of fill this gap. And not only the paid work is thus important when we talk about healthy aging, and we should not neglect that we want to keep people healthy also when they are getting older so that they can support us. They enable our younger people also to work on the labor market, to contribute also to what is happening here in the economy. And maybe you are not used to unpaid work activities and can we really monetize them? But if you have a family and you, for example, rely on your parents to take care of your children, what happens when they are sick? You either cancel to go to work, or you would hire kind of an official that takes care of your children if you have, let's say, no replacement in your family. And for this person, you would need to pay money. And this is the market equivalent. And in some countries, this value can be up to 40% of the national GDP. Because sure, if not your family is taking over, you would have to pay for it. And in the context of informal caregiving in the Baltics, and especially in Lithuania, this becomes very, very important because 90% of people who are receiving the care via informal caregivers. So we need the people to be healthy, to take care of them. And I think this is important when we talk about healthy aging as well. But I do not only want to bring, let's say, the bad news, but also show maybe some success stories. We analyzed a prevention of CVD program in Estonia, and in the context of cardiovascular diseases, not only Europe is, has a problem with cardiovascular diseases, but also, as I learned yesterday during a workshop, in Lithuania, the problem is very similar. And also, although there are programs, people are maybe not yet so interested in signing up for it. But maybe highlighting success stories from other countries, neighbor countries, what could happen if people would participate in such programs might make sense. In Estonia, for example, we could see that an investment of only 20 million euros generates over the period of 15 years a value or a return of investment of almost 8 times. And if you would go to the financial market and say, hey, I have an investment opportunity, give me $1 and you get €8 back, oh, they would be in. And such stories is what we need and what we have to consider when we talk about spendings in the area of health and seeing this as an investment. So what should you do now? What should you take home? First of all, I cannot tell you what to do, but what I think could be helpful is how you are already doing it, bringing really all the stakeholders together to one table and define health as a key indicator for a company's growth and stability, and then align on initiatives that could really contribute to bringing these key performance indicators, as you would say in a business context, forwards. And this includes long-term preventive measures. It is needed that we have this multi-sectoral action, and in the end, it might also be needed to really inject some capital into the economy, but having always in mind that money should be spent efficiently. Yeah, I'm not talking about just throw the money out, but really tracking, okay, which programs are good, which are maybe less good, and then we have the opportunity to really elevate population's health for the younger people and the older people, and we kickstart really a positive value chain. And I'm happy that I could share this perspective here again in the beginning of this day, and I'm very much looking forward to all the input over the course of the day, a lot of discussions during coffee, and thank you for giving me the chance and listening to me.
Yeah, and thank you very much for making workshop yesterday.
Thank you so much. Ir tęsame, iš tikrųjų, gal nepriminėm, kad visi, kas norite, dabar bus dar 2 pranešimai.
Yes, we do have 2 more presentations in the English language. We do have simultaneous interpreting. And we would like to give the floor to Dr. Elias Tambler. And this person is putting every effort to make this assembly happen, to make it good. You've probably listened to him. Please talk to him during the coffee break. And he's going to talk about building a healthy longevity ecosystem through research, innovation, education, and policy.
Thank you very much, Laura. Thank you very much, Saulius, the driver of this event. Thank you to all the honorable guests, to the Israeli ambassador, to dear friends, to Alex, to all the participants, all the speakers, all the dignitaries. It is great honor and great pleasure to be a part of the movement, of the health and longevity movement together with you. And this is what we are doing with this assembly. We are building the health and longevity movement. Our main premise is based on geroscience, on the principle of geroscience, namely that in order to prevent multiple age-related diseases, we need to address the major risk factor or the major underlying cause, which is the aging process. Sounds similar, but that is a new paradigm in medicine and biology, and we promoted one of the first in this assembly. And at the same time, we promote the interdisciplinary approach to health and longevity. Not just biology, not just medicine, but health in all policies, because the issue concerns every walk and every area of life. And an explicit premise of ours is that we promote not just life longevity, but healthy longevity, the so-called health span, the healthy lifespan, the period of life people live without disability, without disease. That is our goal, and we can achieve it both through biomedical intervention and lifestyle improvement. In this regard, the situation for Lithuania is really urgent. In Lithuania, we have one of the fastest declining and fastest aging populations in the developed world, but at the same time, it is also one of the lowest healthy life expectancies and general life expectancies in the developed world, about 8 years, both 8 years less than Israel, 10 years less than Japan. So for all of us, this is a call to arms, this is a call to action to really become involved, become invested in healthy longevity, in research, development, education, public health, the longevity movement building. That's the goal of this assembly. In economic terms, if we succeed, if we manage to extend even 1 year healthy life, this can create massive contribution, massive benefit for the healthcare and welfare system. And without being dramatic, we can say that health and longevity can eventually save our healthcare and welfare systems. In the rapidly aging world, in the rapidly aging Europe, rapidly aging Lithuania, if we are not able to intervene in time to create preventive solutions for the healthy aging, the healthcare and welfare system may simply collapse. So it may sound like we were here talking about some esoteric issues, health and longevity. No, we're talking about our survival. We really need to get to action. And yes, it is possible to extend health and longevity. There are many proofs of feasibility. There are many models, the major process of aging, and for each aging process it was shown that yes, it is possible to intervene, it is possible to prevent multiple age-related diseases. It was shown mainly in animal models, in some emerging human trials. So it is our goal, not just as healthy health researchers, health professionals, but also as health activists, health advocates, to help move those interventions from bench to the clinic to benefit as many people as possible. Here are a few examples from Israel of the geroscience-based approach, rejuvenation of the epigenetic mechanisms, rejuvenation of the cardiovascular system by vegetative endothelial growth factor, DNA stabilization, elimination of senescent cells. Parallel research is done not only in Israel but around the world, and what we look for is collaboration. We look to synergize our efforts because even just from combining minds from different countries, we can improve the quality of research, the impact of research. And it's very important to develop not just interventions for health and longevity, but also measurements of, for health and longevity, the metrics of aging. You cannot intervene or treat or cure something that you cannot measure or cannot diagnose. Unfortunately, we don't have a reliable metric of aging yet, but we have to develop them. And that's an issue that will be relevant for every clinic, every longevity clinic. Recently we published this book, Healthy Longevity Policies and Practices, together with several, not many, but several members of this audience. And I hope this will contribute to developing policies, regulations for the effective and evidence-based operation of longevity medicine. I hope to present to you this book during the awards ceremony, so something to remain for. And of course, we don't forget the healthy lifestyle. We have to promote all the known interventions, such as rest, exercise, balanced nutrition, motivation, but hand in hand with advancing biomedical research. For many older people, we simply don't know how to personalize treatments, so we need to analyze data. We need to combine advanced technology. We need to build up the longevity ecosystem, the longevity community, and that's what we are doing in this assembly. We're building up the longevity community ecosystem. We're involving more and more actors, more and more factors. So that's the goal, to really make the whole world, Lithuania first, and then the whole world think about health and longevity. I'm almost finishing. Let me just give an example from Israel. Longevity advocacy does bear fruit. It does have an impact. We were able, even last year during the war, during the budget cuts, we were able to achieve about 4 million euros funding for aging research. This generated hundreds of research proposals. A very small proportion will be funded, but still the entire country, the entire scientific community became involved in thinking and developing solutions for healthy longevity, for healthy aging. And I suggest to adopt the same model in Lithuania. Even a small funding, small call for proposals, you can stimulate the entire ecosystem. And of course, we always think about international collaboration. Recently, we published this position paper representing over 100 research organizations. I hope together we will move the needle and convince the decision makers that healthy aging is a top priority. And once again, I cannot congratulate you strongly enough for establishing this first in the world international parliamentary initiative for healthy aging and longevity. It was never done before. There are national parliamentary initiatives in Israel, in the UK. This is the first international parliamentary initiative, and I hope it will make a real impact in Lithuania, in Europe, and throughout the world. Thank you very much for doing this.
Thank you so much.
Thank you so much, Ilya, for your enthusiasm and great efforts what you're doing. And now my special pleasure to invite another great enthusiastic person who is doing really a great job in a very concrete, specific field, and great pleasure and honor to have you here, Michelle Hirst. Welcome.
Good morning, ladies and gentlemen. Can I bring you the greetings of my country, the United Kingdom? I'm delighted to be here this morning, and I congratulate you, Sveikas, on organizing such an impressive conference on a very important topic. I am a very unlikely champion of diabetes. I knew nothing about diabetes until I carried my 4-year-old daughter into hospital with ketoacidosis. She was diagnosed, of course, with type 1 diabetes, something which my family and I knew nothing about. And the afternoon that she was diagnosed, my wife and I were summoned to the hospital and given an orange and a large syringe to practice injecting insulin. I struggled as an adult to get my fingers through the hoop and then to get my thumb to connect with the plunger. And I said to the doctor and the nurse, there must surely be an easier way to inject insulin. The nurse disappeared and came back a moment later with a beautiful little disposable syringe. And I said, oh, that's wonderful. Thinking about how a 4-year-old would ever be able to self-manage her illness, her condition. And I said to the nurse, that's fine, we'd like to have these. And she said, oh no, you have to buy them. In the United Kingdom, we have social medicine, a national health service which is free to all, but of course it's not free. We have to pay substantial taxes for it. And I thought there was something crazy about a system which made me pay for disposable syringes, which obviously would make such a difference to the person with diabetes. That was the eureka moment for me. I thought, I can afford to buy them, but there are many people, I suspect, who are not able to buy them. And I resolved then to campaign for disposable syringes to be available to people who are insulin dependent. I was a member of Parliament, so I had, if you like, I had unique access to policymakers. And as a very junior member of Margaret Thatcher's government, I went to see the health officials, and they listened to me and shook their heads and said, it's far too expensive. And I said, I don't really understand why that should be, because a disposable syringe can be used many times before you dispose of it. My daughter used to say new needle when she was when she required to get rid of the old one because it was not so comfortable. So I found it hugely difficult to face with a brick wall of a Department of Health that couldn't find the money for it. And salvation came from a strange quarter. There was an announcement in Parliament that the government was giving free needles to drug abusers to curtail the spread of HIV. Whatever view you take on that, it is a pragmatic policy for a public health challenge. So I asked in Parliament, I asked the Secretary of State for Health what he was going to do for people who were insulin dependent and who couldn't access free needles. And he said nice things, but basically he said no. I had a right to go to the Prime Minister, so I went to her. And I took a glass syringe in one hand with its long needle that had to be sharpened and a disposable syringe in the other. I don't know whether you know, but Margaret Thatcher was an industrial chemist, so before she was a member of Parliament. She had an inquiring mind and she understood immediately the point that I was making. But of course, the Department of Health put up a strong resistance to it on the grounds of cost. And eventually, when I had another meeting with her, she said, what are we going to do? And I said, only you can break the logjam on this. So she did. And because the Department of Health exaggerated the cost, we had spare money for blood glucose monitoring, which of course was essential for people with diabetes. I discovered then that what made the difference was having access, direct access to the policymakers. For years, people with diabetes had tried to get disposable syringes, but they had never been able to get close enough to the actual policymaker to be able to change things. I was, if you like, to use a very current metaphor, I was like the football striker at the goal mouth, just ready to kick the ball in. I got a lot of acclaim for the change in policy. But in fact, the people who deserve the real credit for the change in policy were those who had campaigned for years unsuccessfully. The vital element of getting that policy change was access to policymakers. And sometime after that, I met an Australian senator with type 1 diabetes, and we exchanged experiences of changing policy. And we decided that actually we should set up a global network of parliamentary champions, people who in their own parliaments and in their own policy forums were able to effect change. Change to bring about prevention policies, to bring about early diagnosis so that treatment can start as soon as possible, to optimize the treatment available to people with diabetes, and to secure for the nation healthier people that were able to make a full contribution to society. I later became the president of the International Diabetes Federation, and I went to countries all around the world, and I met health ministers, but vitally, I tried to meet economic ministers, the people responsible for the growth in their countries. And I said to them, please do not regard expenditure as a cost on health. Regard expenditure on health as an investment. And if you are a low-income country and you have people who are disabled through diabetes, who are blind, who might have neuropathic foot ulcers that lead to amputation, who have failing kidneys, they cannot be productive members of society. And I tried very hard during the time I was president to emphasize, I could put up a slide with all the costs of the burden of diabetes rising in every country and the eye-watering expense of caring for people, particularly those who are disabled by the complications of diabetes, which impact, obviously, on the quality of life, particularly of old people. The take-home message from this today, ladies and gentlemen, is the importance of energizing members of parliament to be able to be effective advocates for diabetes in their own country, and so bring about not just more economic growth from productive people, but supremely to improve the quality of life of those who fall victim to diabetes. Thank you very much.
Thank you very much, Sir Kirst. Thank you for what you are doing. Kągi, kolegos, tai tam mes čia ir susirinkome.
Well, and colleagues, that is exactly why we have gathered here, which is to raise those issues, raise health challenges at the parliamentary level to address them. And now, how should we organize the family photo? Okay, let's do that in front of this stage.
Family photo here, all of us, okay? And as soon we do it, as quick we have coffee. Kuo greičiau sustosim, to greičiau bus kavos pertrauka.
One? No, no play. One, one, one. One, one, one.
Tai garbus šios konferencijos dalyviai esantys salėje.
Ladies and gentlemen, those present in the hall and outside the hall, as well as those watching us online, we do understand that you are interested in having an in-person conversation with a cup of coffee. However, we're looking forward to you coming back to the hall. And we have been warned time and again today to mind the time allocated for the speeches. We would like to issue the same warning once again. And let us return back to the hall. We're going to discuss in the session titled From Strategy to Practice. The keynote speeches in the session are grouped into different topics, and to deliver the first speech, I would like to give the floor to Mr. Alex Friedman from Israel to speak about disability and degenerative aging, because we tend to focus on healthy aging. So,
to have you here and to invite to speak from your perspective.
Thank you. Good morning, everyone. It is a great honor for me to be here again in Lithuania for the second year in a row. First, I would like to thank my dear friend outside, Dr. Ilya Stabler, for his many years of work to promote healthy longevity around the world. You are leading this field in an amazing way, and I truly believe that your work will be remembered in history. I would also like to thank Dr. Stambler and you, Professor Chaplinskas, for the great success of last year's conference. It reinforced this wonderful partnership and led to this impressive assembly. Seeing a whole week focused on our important mission is truly amazing. And I warmly welcome the new International Parliamentary Cooperation Group. This is an important step forward for our shared mission. I would also like to thank the Embassy of Israel, led by my dear friend Shelley Adler-Livne, for taking a central role supporting and helping organize this important assembly. As someone living with disability, I know that the quality of life is just as important as the length of life. This is why healthy longevity is so important. It is about giving people more healthy years, better accessibility, more independence, active lives, and more opportunities to enjoy life. And I may be one of the best examples of that. Despite my disability, I enjoy life, I stay active, and I have had the privilege of helping improve the lives of many others. None of this would be possible without partners, and friends like you. I'm proud to represent Israel, a country that knows many challenges and much pain, yet never stop choosing freedom, hope, and life. Even in difficult times, Israel continues to lead in science, medicine, innovation, and healthcare, while building a better future for the next generation. I would like to thank Lithuania, a true friend of Israel, for the friendship, cooperation, and for studying on the right side of history. More than 3,000 years ago, the Bible spoke about simple dream, a good old life. Today, together, we have opportunity to turn that dream into reality for millions of people around the world. Thank you very much. Ačiū. Oh, thank you. 1 minute, please.
Yeah, thank you, Alex Friedman, for inspiring talk, and it's always pleasure to have you here in the conferences when we're speaking about the health. Thank you. And now it's my honor and privilege to invite Your Excellency Shelley Hagler-Livne, the Ambassador of Israel. The floor is yours.
Professor, thank you very much. What a pleasure to be here, and what a pleasure to speak after our dear friend Alex Friedman, which I can say truly shows the true spirit of Israel. We haven't read all of his CV, but this is a person who chose to take a disability and to change it into a journey of life. He is behind the very successful NGO that calls cripple, not a half a person. Alex, I think you are 3, 4, 5, 10 people in one person. The things that you do and the mountains you move, together with Elias Tembler, Dr. Elias Tembler, our dear friend, Yona, who came from Israel, and many other guests, you're able to do such an amazing things for the benefit of us all. And I think this is the true spirit of Israel, beside all of the difficulties that we're going through. So we would like also to thank you. So I want to thank this amazing forum. I was here in September in the first forum, and I think the difference between September to today is amazing, and especially the speakers before me spoke about it. Longevity or healthy life is not only a matter of the Ministry of Health. This is a general thing of economy, of finance, of culture, of education, and only by standing together it is possible. So I'd like to congratulate you, Professor Chaplinskas. It's unbelievable what you did here. I can really see the difference, and I want to congratulate Lithuania, which is generally speaking a very brave country, to look at the eyes of the problems and to say, okay, let's do something about it. This is our future, and this is what we need to do. We learned earlier this week that on each euro that you save in prevention, in education, in culture, in early years, you save 50 euros later on. So it's actually something that the country itself really wants to do. It saves not only that it's better for the population, it saves a lot of money for the country. And this is the beauty of this thing. I want to say that personally I also have it's a very important topic for me. I lost both of my parents in very early age. And I believe that if things would have been different, if education would have been different, if many circumstances would have been different, it wouldn't happen. And this is something that touches, and I think this is why I see so many people in the audience, because it's concerns all of us. So Israel is one of the countries that have the largest life expectancy, which is something very strange considering all of the stress that we are going through. But we established earlier this week that stress is healthy in some ways, right, Dr. Stemler? Yeah. And this is why this subject, among other subjects of health, is something that we work very closely. We've signed with the Ministry of Health, our Ministry of Health and the Lithuanian Ministry of Health, an agreement in last September. And ever since, we are working very strongly in what we call a friendship that saves lives, to bring together the knowledge that we have in Israel and our experience, in many cases a very difficult experience and a lot of knowledge that we gain through very terrible things that happen to us, and to bring it together with the courage and the knowledge that is here in Lithuania, and to bring this friendship to save lives. We're working on underground hospitals and preparing for emergencies, etc. And this longevity is only a very important path in this cooperation, which we are very, very grateful for. Innovation, digitalization, you know, all of the buzzwords, I won't repeat that, but this is very important. We come as a partner who brings a lot of experience and knowledge, and it is our privilege to meet the community and the government and the parliament of Lithuania and to work together. Demographical challenges don't know boundaries, and this is something that really needs to alarm us all and to tell and to show the countries that we need to cooperate and to build solutions together. And this parliamentarian initiative only demonstrated. So once again, it is my true privilege to stand and to represent my country here. We're very proud. We're very proud of this cooperation, not only because of the rich history that Lithuania and Israel share and the Jewish people. Ačiū labai. Thank you.
Dėkojame Izraelio ambasadoriai.
We thank Her Excellency Ambassador of Israel for her participation in the events of the whole week and for her continuous support. The next speaker is Dr. Julius Neverauskas, and he's going to talk about a very important role of mental health for healthy longevity.
Dėkui labai, apie šitą temą mes galim šnekėti visą dieną.
Thank you. We can talk, we can dedicate an entirely separate conference for this topic, and Mr. Saulius Čaplinskas said that 10 minutes in the Seimas means 6 or 7 minutes, but not 11 minutes. So I'll try to stick to my time. So if we want our aging to be healthy, and that's what I want, because unhealthy aging is not good, and for that, mental health is very important. Biological health is not enough, although biological health allows us to live longer, but mental health allows us to be willing and to want to live better lives. And for that, we need social connection and environment that's adapted to various people. For this reason, mental health is not just a complement to healthy aging. It's a prerequisite, because without mental health, health is not possible at all. Why is the case? Why does mental health lead to healthy aging? Because it affects our behavior. If we are mentally healthy, our behavior is healthy, and it increases our health and our both biological and mental health. It affects our biological diseases. It affects our cognitive functions, mortality and suicide risk. Our country is among the ones with the highest risk of society. It also affects our social relationships, our resilience to stress, loss, and change. The longer our lives, the more losses will be experienced. And if our lives will be very long, we might become very lonely because all of our friends will die, our children will die. Of course, our long life may pose certain challenges for those reasons. So it affects our health literacy and our decision making. It affects our loved ones. And most importantly, it supports the meaning, dignity, and the purpose of life. Mental health has 6 perspectives. It can be the perspective of the whole society, the perspective of the whole healthcare community, which includes healthcare professionals, the perspective of all doctors, the perspective of mental health professionals, the perspective of healthcare organizers and leaders, and also the politicians' perspective. We need to understand the fact that mental illness is not a direct consequence of aging. We need to recognize those diseases, treat those diseases, and prevent. Isolation, loneliness are very important factors for our mental health, and we need to avoid that to the best of our ability. Looking for help must become a normal health behavior. We spoke about healthy aging does not begin at the age of 70. It begins at the beginning of one's life, and we are very well aware of the problems that screens and devices pose. So we are accumulating our health capital since childhood through fostering relationships, physical activity, sleep, work, meaning, and by learning to cope with challenges. From the perspective of all doctors, every doctor, general practitioners, cardiologists, and other specialists should be also the gateway to the mental health. And all doctors should be able to recognize the signals of depression, anxiety, addictions, cognitive impairment, and other risks. They need to normalize it and refer those patients to mental health professionals. In addition to this, general practitioners should provide support in times of challenges. When we talk about the perspective of the whole healthcare community, it's all nurses, physiotherapists, ergotherapists, nutritionists, pharmacists, social workers, and public health professionals. They should, within their competence, should pay more attention to the mental health of the older population and try to prevent certain diseases. when it comes to the mental health professionals' perspective, they need to be able to early detect mental health issues and treat those diseases. Psychological interventions in older age should be adequate. Families and caregivers also experience challenges while taking care of their older members of the family. They need to receive education, they need to acquire certain skills, and they need to recover. And even though currently we don't, there's no stigma of going to a psychiatrist. Currently, it's normal to go to psychotherapy, and this profession is very well liked and very attractive in Lithuania. But nevertheless, there's still some stigma, and it's important that the users of those services felt okay about receiving mental health. When it comes to the perspective of healthcare organizers and heads of institutions, it's important to integrate family medicine, mental health, geriatric care, rehabilitation, social assistance. They all should be part of one system. And it's very important for leaders to pay attention to the mental health of their employees, doctors, nurses. Because if a doctor, if a healthcare professional struggles with mental health, they cannot help others. And when it comes to politicians, we can see they do a lot in this area, but we understand that mental health should be a part of all policies across all ministries and community services, and to the strengthening of primary health care, and into the organizing of psychotherapy and psychological support for older people. Therefore, healthy aging could be a strategic choice for the state only when mental health occurs in the budget, in lawmaking, in self-governance, in service standards, and in result indicators. And finally, I would like to thank the organizers of this conference. And there's a series of events related to healthy and longevity, healthy aging, and I hope that our discussions will be translated into practical steps. Thank you. Thank you, Professor Neverauskas. Are there any questions? Because we still have 1 minute left before another presentation. I would like to invite Professor Jūratė Macijauskienė, and she's going to give us a presentation about dementia prevention, which is a relevant issue, and what are the risk factors.
Good morning once again, everyone. Allow me to continue on another important field related to mental health. The World Health Organization has already focused on the challenge of dementia a decade ago. We have now a number of documents setting different targets for us. Last year, on the 25th of September, United Nations have recognized dementia among the topical chronic diseases, and something that we will focus in the future even more in order to reduce the number of cases of dementia. According to the Lancet Commission, we have over 51,000 cases, dementia-related cases, and the number is set to increase by 33% in the future. So we will have more patients suffering from the disease in the future. The report from 2024 identifies a number of different risk factors related to dementia, and they were supplemented by 2 additional potentially modifiable risks. So in addition to hypertension, hearing impairment, smoking, obesity, depression, lack of physical activity, diabetes, rare social contacts, excessive alcohol consumption, head injury, air pollution, and lower degree of education, high LDL cholesterol levels and uncorrected visual impairment were added to the list. As for non-modifiable risk factors, those are age, gender, and genetic factors. Race is also sometimes mentioned among them. And this illustrates a lot of what we are talking today. That is, that we have to be concerned about our health at different age periods, and we should focus at the early onset of dementia, which is in the early age. If we manage to contain all these risk factors at an early age, we can reduce the number of dementia cases. If we group all the risk factors, we can see that most of them are connected to cardiovascular disease risks, as well as to our social and cognitive reserve. We talked about social isolation and how important it is to maintain social contact. So let me briefly focus on a few of these risk factors. First, the limited access to education. As for the situation in Lithuania, the statistics is fairly good, but when it comes to lifelong learning, we are still lagging behind the EU average, because improved level of education contributes to the reduction of the risks of dementia, because lack of education contributes to the development of various neurodegenerative diseases. We have a number of people in Lithuania suffering from hearing impairment. It's a good thing that hearing aid is reimbursed in Lithuania. Perhaps not all of those that can access reimbursement for hearing aid do actually do that, but still it's a good thing that we have this opportunity of reimbursement. Head injury, another risk factor. We should make sure that we reduce this risk to the minimum. When it comes to this risk, men are more likely to suffer head injuries compared to women. This is usually related to involvement in car accidents mainly. Unfortunately, minor head injuries are not included in the statistics, and this is something that can also be attributed to dementia in later years. Hypertension, another risk factor. We know that in Lithuania we have more hypertension cases compared to other countries, and this is probably due to poor control of hypertension in our country. Evidence shows that prevention of hypertension also, and done at an early age, can reduce dementia risk at a later age. And our new national project is Mission 75/2028. We want to ensure reduced hypertension cases by the age 75. Alcohol abuse, another risk factor, which is related to different health issues. When it comes to alcohol abuse, the situation in Lithuania is improving. In 2024, the figure was the best recorded in the last 10 years, and yet it still remains too high compared to the OECD average. Smoking, again, something where we say that there is no safe dose. Scientists are also speaking of certain genetic predispositions and how smoking correlates with that. If we look at the situation in Lithuania, the blue dot marks the OECD average. Green represents a good situation, red bad situation. So when it comes to smoking and alcohol consumption, we exceed the EU average in these rates. Obesity, another risk factor, which contributes to inflammatory changes in our bodies. And when it comes to the situation in Lithuania, again, we see that we have more obese people in Lithuania compared to the OECD average. Depression is another contributing factor. And in Lithuania, depression is the #1 disease in our country, and the tendencies are growing. Rare social contacts, another factor, the damage of which is equated to the harm caused by smoking, alcohol, and overweight, and is associated with 50% increased risk of dementia. We have heard today already from the representative of the Ministry of Healthcare that 30% of the people in our country identify as themselves as lonely. And so we have been focusing on this issue lately a lot. Lack of physical activity, another factor. According to the World Health Organizations, those recommendations are fairly minimal when it comes to improved physical activity, and statistics shows that we sometimes even fail to abide by those recommendations. And science has proved that physical activity improves the brain activity and can even improve the volume of the hippocampus, the part of the brain responsible for memory. The situation in Lithuania is fairly well, but if we look into the situation between the different age groups and their involvement in different strength exercises, we would like to see an improved situation nevertheless. Diabetes, another risk factor which can harm blood vessels of the brain and promotes the accumulation of beta amyloid. There are a number of different cardiometabolic risk factors that people suffering from diabetes are exposed to. And as for the situation in Lithuania, we have high numbers of people suffering from diabetes, and we're looking forward to the reducing numbers of the cases of diabetes. Air pollution, another risk factor. We tend to hear a lot about the increased particulate matters in our air, and this is something that penetrates deep into our lungs and enters our bloodstream, which is a risk factor. In Lithuania, we also look at the high LDL cholesterol levels, and the risks are especially acute at the senior age. We believe that this so-called bad cholesterol contributes to accumulated amyloids, and this contributes a lot to dementia. As for the prevalence of the risk factors in Lithuania, we see that we are among those countries that have the highest LDL cholesterol levels. Another risk factor, which is uncorrected visual impairment and related to neurodegenerative processes and damage, And the latest surveys revealed that in Lithuania, the prevalence of cataract is higher than expected. And as for the cataract operations, we would be able to achieve better results if we were to compare ourselves with other countries. So, as for all of the risk factors, they all contribute to neurological damage and can affect neurocognitive reserves. As for what we could do, both at the individual level and the level of the population, well, we must take certain decisions, including those by the healthcare specialists and politicians. The well-known finger study by the Finns demonstrates that through multi-intervention we can achieve lower cardiovascular risks and better brain health. In Lithuania, the University of Health Sciences and other partners are involved in Jade Health project. And we hope that at the end, at the completion of this project, we will have very important documents that will contribute to improving the health of our brains. Thank you.
Thank you, Professor.
Honor for me to invite Dr. Michal Jezwinski from United States. So the stage is yours.
Here we go, I got it. I have it. Okay. All right, so first of all, I'd like to thank the organizers for inviting me. It's truly an honor to be here and to give this brief presentation. So I'm just going to make a few points here today, and they're all related to three concepts that are contained in the title of my talk: Geroscience, healthy aging, and the longevity dividend. Skip this. So the demographic definition of aging is that aging is the increase in the hazard of mortality over time. And here the critical element is time. However, time is neither a substrate nor a product of aging. So understanding aging does not mean understanding changes in time. It requires some other factors to be taken into consideration. So if you look at time, time is the fourth dimension. And time is change in location equivalent to a change in space. And so this gives you an example of a tesseract, a hypercube, which is a cube that has incorporated the time element, fourth dimension. And so lifespan is a trip through space-time in 4 dimensions. Now, we see that there are many changes that occur during aging, and this is an example of cognitive ability as a changing element during aging. And there's a lot of individual variability involved, and a measure of biological age is change here, as opposed to a measure of calendar age, which is time. And you can see that different individuals vary in their rate of and their position according to the average, which is the salmon-colored line. Some are better at it, some are worse at it, as a function of age. And then, of course, there are age-related diseases as a cause of death, age-related. This is not necessary to go through the details, but cardiovascular disease is at the top, then comes cancer, and so on. Many of these are chronic diseases, except for infectious diseases. They're all chronic diseases. And chronic disease, the major risk factor for them is biological age. And so biological age definition is aging is the progressive decline in functionability, and it manifests as a decrease in resistance to stress, damage, and disease, and is characterized by an increase in the incidence of degeneration and neuroplastic disorders. And these latter elements are not the actual biological aging, they are the manifestations of aging. They're the diseases and disorders that have as their source biological age. So, how do we determine biological age? Well, we look at biomarkers, and there are many domains that we can look at in biomarkers, and we have to assemble these biomarkers some way, and we like to use the deficit or frailty index, which is a very simple method. You just count the number of deficits, divide by the total number of deficits scored, and you come up with a fraction, proportion, 0 to 1. And here's the key, that healthy age is the inverted frailty index. 1 minus frailty index equals healthy aging. And so healthy aging is related organically with biological age. So why can we do this? Well, we can do this because the aging organism is composed of networks. Networks composed of nodes, which are the molecules here at the lower end, that interact with each other, and in interacting with each other, they form the cell. And the cells interact with each other to form tissue, tissues form organs, organs form organisms, and the organisms form societies. And you have, as you go from the lower level to the higher level in scale, you have an emergent property appearing because of the interactions that occur between the elements. So the whole is greater than the sum of the parts. And these networks display nonlinear dynamics. These are some of the properties of a frailty index. It's predictive of mortality at older ages. It's heritable, which is very important, because it allows us to study genes that are involved in healthy aging. And we've uncovered several genes that are related to mitochondrial metabolism dynamics. And so our model is here presented as aging, biological aging, is the decrease in complexity of the organism as a function of age, biological age. And you go from a high dimension system with multiple interactions to a lower dimension system with fewer components and fewer interactions. And because of this, we found that because of this decrease in complexity, there's an increase in resting metabolic rate. That's the energy required to maintain the body's basic function. Not anything involved in the cognition or anything else like that. It's just basic function. And that's very important because it means that as the organism is losing coordinated function, integrated function, it takes more and more energy to sustain it. So I said that we can study genes and networks of genes by using the healthy aging paradigm here, the outcome of healthy aging. And we've done this, and we have identified using epigenetic marks. Epigenetic marks are marks that are not heritable necessarily from are not heritable necessarily from one generation to the next of the organism, but they are responsive to the environment. And the ones that we're looking at here are methylation of DNA. And we found 20 such gene networks, and 13 of those were related to brain function. These are the 5 top ones. They're all brain functions. So the brain has an outsized role in biological aging. So if we look at this scale from birth to death, we find that there's a point at which morbidity begins to appear, and we begin to accumulate various morbidities, multiple morbidities. And when we do that, this is where geriatrics comes in, because geriatrics has the role of improving quality of life with disease present. On the other hand, before then, geroscience, which posits that there's a biological aging process that is the major risk factor for chronic disease, that's where geroscience comes in prevention, because it allows us to in some ways, prevent to extend lifespan and health span at the same time. This is the intervention period. And the interventions that we can use are diet, exercise, we've heard about those, social activity, and productive pursuits. We haven't heard about that much, but I'll mention that in just a moment. And there are therapeutics as well, which are in clinical trials. And so our model of an aging organism is shown here. Local interactive networks together show emergent properties that lead to the complex adaptive behaviors, which can then also feed back on those lower networks in positive and negative ways. And the organism interacts with the environment, both at the level of the local networks and at the level of the complex adaptive behaviors. And this is where diet, exercise, social activity, and productive pursuits come in. And this is where the epigenome comes in, because epigenome is the interface between the environment and the genome. So now, let me say where this leads. So if we can delay aging, measured by biological age, and extend healthy aging, we will find that this is by Goldman, from 2010 to 2050, we'll see an increase in, we'll see an increase in the number of people who are healthy and non-disabled. That's the top blue line. Now, this is much better than decreasing the incidence of just cancer or heart disease, which are those lines below there. And even disabled, people who are disabled and their aging is delayed, show a lower number of incidents. And then finally, next, you see that to the right that this entails a cost. So decreasing cardiac disease increases the cost, because now you have people living longer, you have to treat them, and there's a cost. This is all on American statistics. This is Goldman is an economist. You have an increase in the cost of social benefits like Medicare and Medicaid, for cancer also. And it's even more serious if you delay aging, because you're having people live longer. However, there's a benefit here, because if you can have a social fix, by delaying the retirement age a little bit, you can get actually a savings. And that's shown by the blue line. The solid blue line, the one that rises high above there. This is $2010. And it's nothing comparable to just eliminating heart disease or cancer. So this amounts to approximately $7.1 trillion over a period of a decade. It's a lot of money. That's the dividend. That's what Goldman calculated. Now, how can you accommodate that? Well, you have another study done by Chen et al. They developed an Aging Society Index, which measures the successful adaptation of society to aging. And you see there are 5 domains, and the top one is, I think, the most interesting one, because it involves production and engagement, productive pursuits and engagement, which I stressed a little while ago. And you can see, and it's not important what the exact composition of that aging index is, but this is sort of how it's distributed across the world. You see some countries that are bright red, they're the ones with the highest level of societal adaptation, because they have the highest society index, aging society index, and then you have the lower ones. And this is, again, where it's important to consider what we have in terms of interventions. We have diet, exercise, social activity, which is engagement, which they specified, and productive pursuits. Now, to have productive pursuits, we have to make certain adaptations that we
I'm very sorry, but time goes by.
Okay.
And sorry.
All right. Well, so I'll just leave you with this slide at the end. These are the policy recommendations.
Thank you very much.
Thank you very much.
Thank you very much. And our next speaker, Alexander Tetzlatza from Germany. So the floor is yours. And the presentation is about our rights to longevity and health.
So, thank you, it's an honor. Really, you are so punctual as German trains used to be, let me say. So, I'm just trying to see you from my presentation. So, how do I get it on there? I found it, but it's not on. Perfect. Thanks a lot. So, honorable members, ladies and gentlemen, thank you. Thank you for having me as someone who has had the privilege of addressing both the German and the European Parliament. I really appreciate what honor it is to stand before you today. So thank you for your invitation, and thank you for the work you're doing. And to be frank, even more, thank you for the hard work you and hopefully we all will be doing after this day. So I only have a couple of minutes. So I think in a sentence, but you often heard this Estonian example as a good example for digitalization, but I really think what Estonia did for digitalization could Lithuania do for longevity, or could become Lithuania for longevity. And I would like to explore that, what that actually means and what it actually requires, not in theory, but from this House, from this Parliament, what political choices you would need to take to make that possible. But for me, I would like to start with a personal story a little bit. For me, this discussion is not abstract. My grandmother is 105 years old. In 2 weeks, she actually turns 106. So her life really is a living reminder that healthy aging, longevity, good years, or however you would like to call it, is possible. But it also raises the deeper question before us. So how many more people can reach old age, not merely alive, but with dignity, with independence and health? Because the goal is not simply to add years to life, but we have heard it often today, it's also to have more good years. So that distinction is one of the parts of my talk. So I think the chance to really leapfrog to more healthy years in Lithuania is to learn a little bit from the Estonian example for digitalization, because they did not wait until a crisis really forced its hand on the digital government, excuse me, but they decided early, so actually before the curve, and built the rails, digital identity, X-roads, e-residency, years on. And now it actually leads Europe. We have been there with so many, like every year we're there with a delegation, like trying to learn how they did it. So I think Lithuania can really do the same early decisions now in a different field in more healthy years. So a move from the right to health, more to the right to healthy aging, a right to longevity, really as a national plan, as a national project. So the uncomfortable number you already heard today, and I'm going to skip because the time is already tight, is that the Lithuanian who reaches 65 today can expect barely half as many healthy years as the European average, roughly 5.5, against about 10. So more than half of these years after 65 are lived with activity limitations. And Lithuania is among the 5 EU countries where women lead actually a healthy life much more before the men than in the average. So not all of this, I would actually say maybe none of this, we can discuss male and female longevity later maybe, is a fact of nature. But you have the usual candidates, cardiovascular disease, risk factors. So take this year's policy already knows how to save. So prevention arrives too late, the cost appears as lost healthy lives. So what policy has shaped in the past, policy now also can reshape in a more positive way. So I claim that the right names the duty bearer. So I'm a jurist, so let me be precise here about the word right, because precision is really where this credibility lives. So the right is not an aspiration, the right is not a slogan, it really names the duty bearer. So someone who can be held accountable when it is not met. So and the right to health is not new, nor is it soft. no, the soft law at the margins actually, it's recognized in the European Social Charter, Article 35, won't bore you with the details, it's constitutional traditions from all the member states of the European Union. But what changes over time is not the right itself, but what's considered to be normal, reasonable standard of care. So a century ago, antibiotics, miracle, then dialysis, then statins. So each of them became in terms simply what a health system is expected to provide. So longevity science, healthy aging science, is the next step on exactly that path. Today's frontier becomes tomorrow's standard. So when I speak to the right to longevity, I'm not inventing a new entitlement. I'm saying that the existing right of health is already moving into this direction. So, and the duty bearer is the state, the parliament, that sets these priorities. In practice, that means something very concrete, a 5-year mandate, naming 3 to 5 priorities, that a government can be measured against. That is not philosophy, that is something this House can actually do. Let me say clearly what it's not. So unfortunately, no fountain of youth today. I have to disappoint you. You will not claim immortality, but it's a start to just more healthy years. And sorry, let me go back for this. So where the healthy years are hiding, cardiovascular, alcohol, most of these needs actually needs no breakthrough. It just needs earlier screening and sustainable funding. Yes, I will switch to the next slide. So my experience from the German Bundestag actually shows me that prevention almost always loses. So the budget contest to acute care. So not because anyone opposes it, everyone loves prevention, I always say it's a good thing, but because benefits arrive after, unfortunately, after the next election period. So prevention needs a structure that precedes it from the electoral cycle, or it quietly will disappear. So as I already see you approaching, I will speed up even faster. So you see, and I was so happy to see all the ministers here today, because really health in all policies, it needs to be in all policies. It needs to be across the sector, otherwise it will not work out. So let me roughly jump to the European policy level. So at the European Parliament actually shows the mirror image. So is it just me hearing it? No, okay, so thank you. So in health, Europe really lacks the ambition, but the competence was shared, and is shared between, and politics is very complicated. So actually it took a horrible, terrible pandemic and a hard lesson that the virus does not stop at a border, and neither does aging. So to move the structure. So only now, I think 2024, 25, for the first time, the Parliament has actually full standing health committee. Before that, it was always a subcommittee. So these ambitions need structure before the next crisis arrive. I think Lithuania does not have to build these from zero. We have EIT Health here, we have European Health Innovation Community here, we have a pan-European network establishing here. So a national hub, I hope, is forming here. So I would really like to encourage you to proceed with this way, and maybe like to directly jump to the ask. So really, from frame to commitment for asks, 1, support a group of parliamentarians for healthy aging and longevity. 2, set a measurable 5-year target. Let me be concrete. Close maybe 1 year of healthy life year gap by 2023. From 5.5 maybe to 6.5 years, and also create one cross-party mechanism that survives the next election. 4, report healthy years gained in this House, the way you report a budget, the workplace number to improve, but a measurable target, and a structure to protect it. If it's not measured, it will not happen, I think. So this is what I would call a health balance sheet, where you really can be held accountable, where the Parliament can be held accountable, where you can hold your governments accountable. So one simple shift, health balance sheet as ever measured policy, and every budget, if it's not only by its fiscal cost, but by its effect on healthy life years. I would have loved to speak a little bit more on the WHO program really now for living is, which is a new priority, which I think is really, for the first time, really addressing concretely aging as a major factor, and I really would love to see much more member states acting on that. Sometimes governments need help, parliaments can help governments act. So please, if you're engaged politicians, I mean, really kudos to you. You are doing a wonderful job here, and we need to find more parliaments, more parliamentarians across Europe to follow this example. So this is my team. Thank you a lot. If you're in contact, I will be here around here. Thanks a lot.
Sander. And now we will have topic, also very important and interesting topic about data, innovation and regulation. And now I would like to invite Didier Cournel from Belgium. Please, stage is yours.
Thank you. Thank you for having me. Thank you for the organizers. And I use a bit of technology to be sure to respect the next 600 healthy seconds. And I have to, okay, yes, it will come in a few seconds, I think it's that, or I have to push to some, yeah, okay, it's there. So I will be speaking about sharing health data for clinical trials for longevity. And let's begin with, what you already know. We are living longer in most countries of the world. The progression is good, but it could be better in Lithuania, with a big difference between men and women, like you know. But the most important thing is this one. So today, like every day, about 120,000 people will die of diseases related to old age. For the 170,000 people who will die, that is the first cause of death everywhere, even in the poorest countries in the world. So the average lifespan is increasing, but the maximal lifespan is not increasing. So a human can live for 120 years maximum, and it didn't change so much in the last 2,000 years. Maximum 120, 122 exactly. A mouse can live 4 years, but a whale can live 200 years, and a Greenland shark until 500 years. So the maximal lifespan is in our genes. And with gene therapy, maybe one day we will be able to change this. Maybe one day, I think it could be possible in the next 15 to 30 years. It will be very probably complicated and expensive. AI can help us. I will come back to this. A few facts about big data for health. It is said that about 30% of all big data is health big data. So it's an enormous part of what we know about the world. And we have more than enough health data to know which human clinical trials could start immediately, to know which existing drugs have very probably positive effects and which drugs have negative effects, and for some small longevity progress and to prepare breakthroughs. But there is a big problem. Well, there are many problems, but one of the big problems is that you and me are de facto, and sometimes de jure, de facto not allowed to share your health data. There is no tool existing making it possible to share easily your health data with scientists. Even if you decide to share, scientists will have problems if they use your data. And even if they use your data, they will have then problem to publish, and publish or perish. So very complicated situation because of many things, privacy laws, so-called ethical laws, but that they are slowing science and other aspects. So what can we do here and in other places of the world to have a global health data space? Well, actually, a global health data space is not for tomorrow, but in Europe, we have what's called the European Health Data Space. I have absolutely no time in 600 seconds to tell you how it will be working, but the principle is relatively simple. At the level of the European Union, everything is put together, or if it is possible to put everything together for science, and it is also possible to exchange from one country to another country, and it is also possible for each person to get his or her medical data. That's a very good new law, new legal space. The biggest problem is that it's going slow. Normally, it is only in 2029 that it becomes really compulsory. But okay, I hope that in some countries, like in Lithuania, like in my country, Belgium, it will go a bit faster. So what we should do is constantly remind, and I will come back to this with my last slide, that most people, they want to share health data for scientific and medical goals. They want to share it, except if there are risks for, let's say, that health data is used for other goals. But otherwise, they are really wanting to help to share, especially when it is for non-profit goals. Now, a few words about artificial intelligence and artificial general intelligence. Well, you all know how fast things are going, how fast things are improving, but also how that there are quite a few risks about that. In many domains, human intelligence now, well, in almost all domains, human intelligence now is no longer better than artificial intelligence, but artificial intelligence plus human intelligence is still better than artificial intelligence alone, and is better than human intelligence alone. So we need to have humans working really with AI. We need that more than ever. This makes us capable of the best, but also of the worst. And we are co-responsible for trying to find the best. My opinion is that in an ideal world, and it could be the chance is not nothing that it will be that we will have this situation in a few years, that we would have kind of a CERN-like project for an AI for a longer, healthier, and safer life. Starting at the European level would be the best place to start, because we have money, we have more healthcare people, more scientists also than everywhere in the world, even than in the US proportionally. And we have also more public institutions. Now, a few words about clinical trials. Yeah, of course, clinical trials are very important. Sadly, there are not many clinical trials going on concerning longevity. Why? Why? At the moment, many trials are made on mice. So mice have the advantage of being cheaper than humans, than having a shorter life, but 90% of drugs that work in mice fails in humans. So we need to start clinical trials with old enough people. That's funny, somebody just phoned me. We need to work with old enough people, volunteer, well-informed enough, in good health, interested for themselves and for the community. And you know, at the moment, clinical trials are mostly with young people, and that's not interesting, because young people don't have the consequences of old age, and this would be good for the people following the clinical trials, but also for the community. We need good producer therapies. Here you have a list, and for me, the most important aspect is gene therapies. Once again, I don't think we will have time for a question, but please don't hesitate after to speak to me about this. We need good biomarkers and public results before the treatment, during the treatment, after the treatment. And for this, it has to be compulsory, because at the moment, you know, you have big pharma companies. They make a trial and then they don't like the results and they don't publish it. It's not compulsory, or it's compulsory but not really done. With many markers, but I have no time to go in the details. I go already to my conclusion. Well, actually, there are two conclusions. The first one is I and quite a few other people hope for a global health data space, a system where all health data can be used for scientific research and not for any other use, not for commercial goals and so on, to start clinical test trials to enable everyone wishing it, it's not going to be compulsory, to live a radically longer and healthier life. And who wants that? So I recently organized with the company Niradata international poll in 104 countries, and this is the average answer of the citizens who answered. If a new medical treatment allowed the average person to live decades longer in good health, do you consider that desirable? Yes or no? You see, 2/3 of people who have a meaning, they think that it is positive, and in Lithuania, it is 60%. Thank you.
Thank you very much.
And
thank you.
I have a flyer, let's say, so please ask me, but I will also...
Yes, we will have time during coffee breaks and lunch, and now it's a great pleasure to invite Dr. Georgios Mitrou from Cyprus to speak about evidence-based protocols for healthy longevity. Thank you.
Your Excellencies, Ministers, Vice Ministers, Professors, Members of the Parliament, Your Excellency, Ambassador of Israel, dear colleagues and friends, I'm honored to be here with you today for this amazing meeting. I come from Athens, Greece. The last 7.5 years, 7.5 years, I've been in Cyprus. I'm an internal medicine consultant. I work in primary, secondary, tertiary, quaternary level of care, rehabilitative medicine, and we try with my team to implement healthy longevity medicine. 1.5 years ago, I had a suggestion with my dear friend Ilya Stambler, and I suggested, what if we can bring together all these international experts who have experience and write a strong basis, a strong evidence-based consensus paper upon healthy longevity medicine with evidence-based protocols. And this is how the book was born. I'm happy because Professor Jasvinsky has covered a lot of my talk. So we are now talking about a new discipline. Healthy longevity medicine is a new discipline. It's not just preventive medicine. It's a proactive, anticipatory methodology so as to help our patients live longer without comorbidities, without diseases. And whenever somebody comes from my team and asks how we can go on with these healthy people, I always ask them, who is the healthy one? How sure are you that you have a healthy person in front of you? So we have to do some certain procedures in geroscience, in gerodiagnostics, and the biological markers, as also the professor said. We need more work, scientific work, and guidance, discussion with researchers, clinics, universities, academies, so as to make it even better and possible for the public. So this brought the book Ilya presented to you, the best practice and protocols, which is based on the expert opinions of members of the International Longevity Alliance. And we suggested these practices in healthy longevity medicine. Of course, the primary goals are to preserve life and health in old age, to extend the health span, and this common goal brought these evidence-based protocols in practice. I will pass very, very quickly all these previews. You have already listened from Professor Zawzycki, and which may be these interventions. Different kinds of neuromodulation, and I'm talking about non-invasive methodology. Pulsed electromagnetic fields, photobiomodulation, the medical oxygen ozone therapy under the CIOT evidence-based protocols I presented yesterday in the academy, the hyperbaric oxygen therapy and hypoxic training, the quantic diabetic magnetotherapy, widely used in Asia and also Southern Europe and Southern America, the advanced glycation end products risk assessment and therapeutics, chelation therapy, the DROMS and PAT test, which is very important, so as to check the balance between oxidation and reduction in the patient. Some patients take a lot of supplements. They don't know that if you go too much in the reductive state, you may have severe risk for cardiovascular disease. Glutathione NAD testing, analysis, and individualized treatment. Peptides, peptide bioregulators, the Neurogene brain training by Neurotracker X, which comes from the University of Toronto. It has helped really a lot of people for better even rehabilitation after strokes. Genetic and epigenetic screening and therapeutics, the gut microbiome testing, screening, and health dashboard analytics and personalized therapeutics. We have listened a lot during this conference, and various other putative geroprotective medications. However, in the manuscript, this ILA position paper would not advocate the use of those or other specific interventions in clinical care, but rather provide examples that are currently proposed by researchers in the scientific literature. That means that it is an open paper to discussion. So, longevity medicine is essentially a research-based and research-coupled enterprise, hence facilitating medical longevity research is of vital importance, and it is research-driven. So, translation to implementation requires rigorous science. So, in conclusion, in 2010, I finished my PhD in gerontology by the University of under the auspices of the University of Southampton Center of Research in Aging in Europe. When I went in Greece and I explained to them that I'm full of appetite to help, all of them laughed. Now the Gerontological Society, the Geriatric Society, founded many years ago, has 99.9% of the board members passed away. Geriatrics opened 2 years ago as a postgraduate. So the system is continuously on the disease, focused on the disease, not in the prevention. Healthy longevity medicine is, as I said, an anticipatory, let's say, methodology to help people live longer without disease. And I will get the opportunity by Sir Michael Hirst. We experts discuss about diabesity, diabetes plus obesity. And there are a lot of patients coming, they have listened about healthy longevity, and they want to enter some certain protocols to have some certain help. And I always ask them, what have you done for your blood pressure, your blood glucose, your blood cholesterol? What have you done for your weight control, your levels of stress, your levels of sleep? Because diabetes type 2 can be reversed, but we cannot enter healthy longevity medicine if we have not covered the basics of the primary preventive medicine. Thank you very much for your attention.
Thank you very much for perfect timing. And now I would like to invite Dr. Ugis Klietnieks from Latvia.
So, dear Excellencies, colleagues, longevity friends, so I will try to, oops.
We see already.
Yeah, you see my presentation. Yeah, I will try to explain health. What is health? Because we have a health definition. It's quite negative, the absence of disease, and it's not suitable for us in the practice. And yeah, there is one very interesting and new approach, and there are the hallmarks of health defined, and everybody knows these hallmarks of aging, but the similar approaches with health, and there are 9 hallmarks of health, and these hallmarks are associated with a healthy state. They are associated with, yeah, and if there are any perturbations should be vastly pathogenic, and maintenance of or restoration of the hallmarks is pro-health. They help to keep the healthy state. These hallmarks are divided into 3 groups: special compartmentalization, homeostasis over the time, and adequate response to the stress. Here you can see all 9 hallmarks, and I will very fast try to little bit explain more deeply each hallmark. So, and this is the psychosocial adaptation is newly added hallmark. Here is the matrix of all hallmarks, and this matrix illustrates each hallmark of health operates across every level of the biological organization, from the molecules to the cells to the organs and physiological systems and the whole organism. The first hallmark, the barrier integrity, and it's very important, and it starts from the organelle level, the nucleus membrane, nucleus lamina, and then mitochondrial membrane till the skin barrier. And it could be one of the most important hallmark. The second hallmark is containment of local perturbations. It's the ability to contain the local damage and prevent them from spreading systematically in the system. The third hallmark is recycling and turnover, and there are a lot of important systems, for example, to our immune system attacks these old cells or functional cells or cancerous cells, or inside the cell there is autophagy, and then these proteasome systems what degrades these damaged proteins. Integration of circuits and rhythmic oscillation is very important, and health depends not only on individual components but also on their coordination and timing, and integrated biological circuits and synchronized rhythms from cellular clocks in the cells, and there are 2 genes that are responsible for them, to the whole organism's circadian regulation. Homeostatic resilience from homeostasis to allostasis, and it means the ability to recover from the stress and return to normal optimal function. Yeah. There are some markers for this allostatic load index. You can see here, and we can detect these markers in the body. Response to stress systems includes hormetic adaptation and repair, and moderate stress can strengthen biological defenses and promotes longevity, but excessive stress or chronic stress overwhelms these systems, leading to dysfunction, accelerating aging, and diseases. Okay, I will skip. Hormetic regulation. The Nietzsche, very famous Nietzsche citation, what doesn't kill you only makes you younger, but it actually really works in modern biology and in the cellular level. And you can see here exercise. If you exercise, you are going stronger. Diet restriction helps. Thermal stress or cold stress, cold plunges, and or cognitive stress to learn something new. And very important is repair and regeneration is the secret of long life, starting from DNA repair, genome stability, until cell identity reprogramming and mitochondrial problems, and of course organ repair, etc. This hallmark, repair and regeneration, is the longevity blueprint, and as we age, we lose this possibility to repair our body, our cells, our organs. And it's a secret for long-lived animals, and you can see here bowhead whale, who lives more than 200 years, and they checked all what happens in the cells, in the lot of biological systems, and then the science found that especially genome repair, some proteins who enhance genome repair is due to them, bowhead whale can accumulate mutations in 200 years at the same level as mice in 2 years. Yeah, all health problems typically begin locally and then spread across biological systems and organization levels. And whether outcome is recovery, chronic stress, or accelerated aging depends on the body's ability to contain the damage, restore homeostasis, and maintain resilience over the time. Mental health and physical health are deeply interconnected. And the future for health evaluation, precision multiomics, and by integrating genomic data and epigenomic, transcriptomic, proteomic, and metabolomic, of course microbiomic, we can measure individual health markers, assess biological age, and what is very important, identify vulnerabilities very early before diseases starts. And it's very important for longevity medicine, especially if the patient is 40 years old without any disease, and what we can suggest him and what we are going to do. And we can test, but of course we have some microbiome tests, we have this some genetic tests, but metabolomic tests in this moment in clinic are not available. So, and this approach enables continuous monitoring, possibility to monitor resilience, repair capacity, metabolic health, immune function, and cognitive performance. And combining all these biomarkers, we can support very healthy life and to promote longevity. Okay, thank you.
Yeah, thank you so much. Thank you very much. And our last presenter before lunchtime is Dr. Jesper Eugen Olsen from Denmark to speak about the screening and prevention in population. Thank you.
Well, thank you very much for inviting me to come today. I'm from Denmark, and I'll talk a little bit about screening programs. I mean, do we want to screen everybody? Does it work? What kind of interventions should we offer? Yeah. So, screening offers the opportunity in healthy individuals to see if there's a disease process and to intervene in those cases, at least where we have a disease. However, there's also a lot of problems with screening. You inform of risk, there are many false positives, and that gives challenges, right? It creates anxiety and so on. Okay, let's do it. So in Denmark, we have a lot of screening programs. For instance, if you turn 50, you'll get a letter in your box. There will be a little plastic tube you put in your feces. It's being sent to the lab. If you have blood, you will get a coloscopy, but it has only a positive rate of 10%. So it will create a lot of worrisome, but it will also find early cases of colorectal cancers. That allows us to intervene and, what we all want to do, increase the health span. But we are at exciting times. We all know about AI, but in the biomedical and biochemical and molecular technologies, there's also coming a lot of new tests. And I personally, the first slide kind of was lost, but I'm the CSO of a company called Virogates, which produces products that measure chronic inflammation, and I worked on that 28 years in a university hospital in Copenhagen as a research director, just to get my conflicts of interest up there. But one of the things, of course, I think what I've been working on is really interesting, and it's about chronic inflammation. And why is that so interesting? We all heard about chronic inflammation. The problem is, until recently, we haven't been very good in actually measuring chronic inflammation. But even the early stages back in the 90s with the development of this highly sensitive CRP assay, we could see that there's this underlying state of inflammation, of fire in all of us that predicts a number of all kinds of diseases, from neurological diseases to diabetes, to cancers, to cardiovascular diseases. So my research and my group's research has been focusing on reasons for, common denominators for a lot of different diseases, because if we could intervene there, we could actually prevent a lot of disease. So I'm jumping a little bit here, but it's because in Denmark we also asked the question, could we from the government offer some screening to the general population? We all know what bad things are. What about if we said you get free nicotine substitution if you're a smoker? We teach you about dietary interventions. If you're overweight, we give you free fitness cards. Go and do all these things that we do. Could we, from the governmental side, reduce the number of, increase the health span and reduce mortality in the general population? So 10,000 people were invited, 6,000 had every second year follow up with a dietist, with the exercise, with so on, and getting all these free nicotine substitution and so on. 3,000 were just informed about their risk. And the same age and sex match individuals, which was 30, 40, 50, and 60-year-old Danes, were followed in registers, 50,000 almost. So could we do something about that? Well, we came in and measured chronic inflammation in this population, this biomarker called SUPAR, It's a long word, really, soluble urokinase plasminogen activator receptor, but just SUPAR. And we could see that individuals who had elevated SUPAR, which is just lost in the bottom, had a 4-time increased risk of dying in the observation period. And one of my PhD students also did a lot of work in this area, and we, at baseline and 5 years later, we measured their SUPAR and related it to their lifestyles. And what you see, for instance, the one decreasing is individual who stops smoking. So if you stop smoking, you lower your chronic inflammation. But also you see probably the best advice also in longevity right now, exercise, how much exercise influences your chronic inflammation. At the bottom, at baseline and 5 years later, people who exercise a lot really control their chronic inflammation, but too much Netflix and too little steps and all that, and you increase your chronic inflammation. Actually and if you add all these things up, by 44% increase in chronic inflammation in 5 years. And when we looked at the 5-year outcome and how you changed your life, predicted your cardiovascular risk or mortality, we saw more than a doubling in mortality if you had increased your chronic inflammation. But back to the Inter 99, can we from the government do something early intervention? And the results were published in British Medical Journal, and there were no difference, nothing whatsoever, giving 30, 40, 50 or 60-year-old individuals interventions for 5 years and then say after another 5 years, 10 years, did it affect cardiovascular disease and mortality in the population? And it did not. But my take-home point here is that when we analyzed for individuals with high SUPAR in the intervention arm compared to the 47,000 individuals in the control arm, that there was actually a half risk of developing cardiovascular disease and mortality, a half in the risk, meaning that, yes, interventions didn't have an effect, but it does have an effect if you have a risk, and maybe it's natural. A 30-year-old smoker probably won't die before they're 40 anyway, unless they at the same time have a lot of chronic inflammation. So my take-home message is that if we want to do interventions and maybe even screening in the society, we should identify risk. And that can be pretty simple. It can be by measuring chronic inflammation and some other biomarkers for more specific for disease, such as long-term blood sugar or cholesterols and so on. And new biomarkers. We are living in a time where it will be quite easy if the politician says, yes, we want to screen, and we can use AI to interpretate all the results and give personal advice to the individual. So we are standing at a time where I think prevention could increase health span, and we have also heard what the significance in the economy and would be for health span. So that was my words, and now I know it's time for lunch and we're all hungry, so let's go and have some lunch. Thank you.
Oh, thank you very much, and thank you for perfect timing. And ačiū labai visiems.
I would like to thank all speakers, and I would like to thank the audience for listening. I believe that you do have something to think about after those presentations, and it's clear that sometimes even cheaper means and instruments can help us achieve longer lives.
Sveiki, gerbiami konferencijos dalyviai, lektoriai. Pradedame
Welcome back, experts, specialists, for the next session of our conference dedicated to disease prevention and systemic approaches. Since our time is limited, I would once again ask our keynote speakers to stick with the 10 minutes time limit. And so without further ado, I would like to give the floor to Professor Vaidotas Urbonas from Vilnius University Faculty of Medicine to kick off this session, where he will focus on a paradigm shift. He will focus on a healthy childhood, the foundation of longevity.
Ekrane dar kažkodėl tai nesimato. Puiku.
I am children gastroenterologist, and the problems are very close to my professional field and everything that has to do with children, because it's difficult to say when is the start of a human being, what should be considered the start of life. We can discuss it for a long time, but for some diseases, genes are very important. But overall, 80% of our future outcomes depends on ourselves, on our environment, first of all, nutrition, physical activity, stress, various types of stress, chemical stress, psychological stress, thermal stress, social problems related to media. Also, climate change has a negative effect not only on nature overall, but also on human beings. Medications, vaccines, we can talk about all of that, and it all has an impact on our future. It's very popular in scientific community to talk about the first 1,000 days of one's life, which includes pregnancy and the first first 2 years of a child's life. So these first 2 or 3 years is very important for one's future. And you can see a photo of forest near the seaside, and you can see trees from their very onset being affected by the wind. Why is it important? Children are growing very fast, but during the first year, the weight of a child increases threefold, and never again in human life we can observe this quick of a growth. Together with that weight and height, the organ size also increases. And at 2 years old, the brain is already about 80% of its adult volume. And if there are diseases during those years or cases of malnutrition or stress, we can easily impair the development of brain or other organs. And the only organ that decreases, and there's one organ related to the immunity that decreases in size with age. When we talk about nutrition, everyone seems to be an expert. Even the small children, there's so much information on the internet together with the flat earth theory. But the biggest mistake is that adults think that their nutrition is healthy for their children as well. But children have different nutritional needs. And children need more iron, more calcium, more non-saturated acids. Why do children like sweet food? Glucose directly provides energy for the brain, and children's brain use more glucose than adult brain, and it's one of the reasons why children like sweets. And for this reason, I don't restrict sweets for children if otherwise they're healthy and normal. The problems begin when we move from theory to practice. We do have a lot of nutrition recommendations by the World Health Organization and ASEAN organization that focuses on children nutrition. And as you can see, the recommendations are different. The World Health Organization issue the recommendations for the developing countries, but not for Europe, for countries that differ from Europe. In Europe, those recommendations are not always applicable because we do have different goals than those set out by the World Health Organization. And even the definition of nutrition sometimes are different. In 2023, WHO renewed its recommendations for infants, but they were not very professional, and 11 associations all around the world criticized those recommendations. For this reason, we are not following the nutrition recommendations for infants issued by the World Health Organization. We should turn back to the recommendations for our Nordic countries. which is done in Lithuania, because those countries are closer to us in terms of environment and genes. We have a lot of recommendations, and sometimes politicians interfere in those things. You can see the newest nutrition recommendations of the US, and they say that saturated fat can be consumed rather liberally. But for us, Mediterranean Sea region recommendations would be more useful for us. It's difficult to define it, but these recommendations also focus on ecology, and it's at the bottom of the pyramid. Ecology has a big quality, and the quality of food has a lot of influence. More than 100 chemicals were found in the blood of infants or pregnant women, and 42 of those compounds were considered mysterious, and those compounds were not natural, and they were not food. Organic food is a major issue, and organic food does not necessarily contain more nutrients. Sometimes it contains less nutrients, but what's important is that organic food does not contain certain pollutants, which is very important for us today. But it's not only the organic food that it's important. Our environment, toys, air are very important. Also, cookware, Teflon, and other things. Of course, there are certain toxic substances that are used, for example, cigarettes, alcohol. Physical activity also plays a major role. And in Lithuania, we should promote children to engage in physical activity. And I have an idea that sports activities should be free of charge, so we can expect children from poorer families to participate in physical activities. And even when pregnant women are active during their pregnancy, they have less complications after the birth. So these are the recommendations, but at least every child should spend at least 1 hour per day engaging in active physical exercise. We should also talk about stress that is experienced by children related to the increasing rates of divorce, gaming, social media. For more than 10 years together with our colleagues, we have implemented several projects in this area, and we are trying to determine the effect of smart devices on the development of children. The laureate of the Nobel Prize, James Heckman, stated that every dollar generates big returns if we invest into children. Thank you, Professor. Let's move forward. We don't have any time for questions. I would like to invite Dr. Sandesh Gulan, who's going to talk about the global diabetes challenge and the policy responses.
Thank you. Policy without practice is hollow. Practice without policy is limited, and lived experience keeps us all honest. Today, I speak as a practicing GP who has had the privilege of working both in medicine and in public life. And that experience has taught me something very important. The health of a nation is not merely a consequence of prosperity. Increasingly, it is a prerequisite for prosperity. And nowhere is that lesson more clear than in diabetes, obesity, and metabolic disease. For several years, I lived what might be described as a double life. Part of my week was spent in general practice, and the other part was spent shaping health policy as Shadow Cabinet Secretary for Health. Two very different worlds, but ultimately one purpose: improving human well-being. In the consulting room, the questions are deeply personal. Doctor, how do I live with this condition? How do I stay healthy? How do I look after my family? In political life, the questions become broader. How do we design a system that helps people stay healthy in the first place? How do we create communities where healthy choices are easier choices? How do we ensure that people age not longer, but better? And that connection matters. Stats aren't just numbers on a page, but they're individual people that we all here have promised to help. And it reminds us that health policy is never abstract. It is profoundly human. Let me tell you about a patient. Let's just call him Mickey. Now, Mickey is in his early 50s. He works really hard. He supports his family. He pays his taxes. He does everything society asks of him. But over the years, life has become busy. Longer hours, less sleep, more stress, more convenience food, less exercise. Gradually, he develops obesity, high blood pressure, elevated cholesterol, and eventually type 2 diabetes. Did he do this to himself? Is he to blame? No, this is not simply personal failure. This is what happens when healthy choices become difficult choices. The environment shapes behavior. And it's been incredible to hear how research has been going and moving forwards today, yesterday, throughout the conference. But whilst we look to markers of frailty, C-peptides and other markers of early health, gut inflammation, let's just take one step back. Smoking, alcohol, illegal drugs, obesity, poor diet, poverty. What has the greatest impact? If we allow food companies to make food softer and trick us into eating more, if unhealthier food is cheaper than healthy foods, if inactivity is built into daily life, if stress becomes normal, if exhaustion replaces exercise, then the individual willpower is fighting an uphill battle. And that is for people who have a choice, because those in poverty have no choices whatsoever. And this is not simply a healthcare challenge. This is a societal challenge. And it is certainly an economic challenge. Now, when Mickey, my patient, becomes unwell, the cost is not just personal. His employer loses productivity, his family loses time and energy, and our healthcare system has to absorb avoidable costs. Multiply that by the hundreds and thousands of stories that we hear time after time after time, and we begin to understand why prevention matters so much. And I've heard in the panel discussion right at the beginning of our session that people were not attending prevention programs. That is our failure as decision makers. It is not the public's failure. We must create programs that we tailor to local groups and target those most at risk through innovative innovations. One of the most exciting developments in diabetes care has been the emergence of hybrid closed-loop insulin systems. And doctors often get told, I personally get told by patients, Doctor, it gave me my life back. Think about that. Technology, not simply lowering blood sugar, but technology restoring freedom, restoring confidence, restoring independence, preventing further ill health and complications. But like everything, we have the haves and the have-nots. This is a postcode lottery when it comes to technology like this. For example, here in Lithuania, you're only reimbursed to have a CGM if you are a type 1 diabetic. And don't think this is any better in Scotland. And I've just told you that there are huge environmental factors affecting health. So why does this technology matter so much? Because as policymakers, as politicians, as governments, we have a responsibility to the public purse. We must get the biggest bang for our buck, or here in Lithuania, our euro. And the fastest growing challenge we face is type 2 diabetes and metabolic disease. And its rise is absolutely no accident. It follows very predictable patterns. Higher rates in disadvantaged communities, higher rates where healthy food is less accessible, higher rates among those experiencing chronic stress. For decades, we have designed economies around convenience. Today, we are discovering the health bill for that very same convenience. Health is not primarily created in hospitals. It is created in schools, in workplaces, in transport systems, in housing policies, and in our very own communities. And this is why the theme of today's conference is so important. Health in all portfolio areas, not health in some policies. Because every single minister that sits around the cabinet table has a role in serving population health. We are witnessing a remarkable moment in medicine. New treatments are changing what is possible in obesity and diabetes management. The evidence is compelling. The results are impressive. And as a GP, I can tell you there has never been a medication capable of replacing a good night's sleep, sensible eating, and regular exercise. Now, these medicines are powerful, but they are tools. They are not miracles. They work best when supported by healthier environments, by better nutrition, by movement, by social connection, by reduced stress. The goal is not simply weight loss. The goal is an improved health span. Now, gestational diabetes provides one of the clearest examples of prevention in action. It's an early warning signal and a window of opportunity. And we're really good at treating this because babies and their mums tug at our heartstrings, but the elderly and those in poverty do not. The economics are clear. In the United Kingdom, diabetes accounts for around 10% of the NHS expenditure. Now, that money is spent treating complications, heart disease, kidney failure, blindness, amputations. The true cost of diabetes is not treatment, it is delayed prevention. And that is why CGMs are so vital. And this lesson extends far beyond diabetes. But the question is this: are we adding healthy years or merely additional years of illness? Because we are living longer. But it is not uniform across our society. In Scotland, we have a street, and on one side of the street is a very rich area. On the other side of the street is a very deprived area. And there is about a 20-year gap between the sides of the street, between healthy living and mortality. So what should we do? The answers are not complicated, but we need political honesty, not sound bites. We need to treat prevention as an investment, not as a cost. Place health considerations at the center of policymaking. Improve health literacy from childhood. Make healthy choices easier. Expand access to proven technologies and innovation. Support physical activity that is achievable, social, and enjoyable. Invest in mental health and social connections. And measure success, not simply by life expectancy, but by healthy life expectancy across our entire society. So in closing, after years in medicine and public life, I have come to a simple conclusion. The most important health decisions are made far from hospitals and GP surgeries. Healthy people learn better, they work longer, they contribute more, they require fewer interventions, they build stronger, more resilient economies. And the challenge before us is not merely to add years to life, it is to add life to years. And if we have the courage to honestly place health at the center of all policymakers with targeted interventions, I believe that that goal is entirely within our reach. Thank you.
Thank you for your nice presentation. So, toliau mes pratęsim.
Let's continue with the topic of diabetes. Dr. Lina Zabulienė, endocrinologist, she's going to talk about the diabetes situation in Lithuania.
Labadiena, gerbiami Seimo nariai, kolegos, svečiai.
Ladies and gentlemen, good afternoon. I'm going to talk about prevention of diabetes in national policies, and I would like to talk as a doctor endocrinologist, and I have patients whose diabetes could have been prevented. When we talk about diabetes in Lithuania in 2024, we had more than 160,000 type 2 diabetes patients, and every year this number increases by 4%, and it's type 2 diabetes. However, the number of children in Lithuania who have diabetes is also increases, and in 2025 we had 1,147 children with type 1 diabetes and age from 6 to 17, and children are dependent on their parents, on their teachers. They struggle to live their everyday lives. They have additional tasks in their daily lives. They don't just learn physics and maths. They need to measure their glucose in blood, which is a challenge for children. We have 3 levels of prevention. Primary prevention, where we try to prevent the disease in the first place, and it has to do with obesity prevention and the changing habits of the population. We need to start in childhood, and these risks are often determined by income, our social environment, and if we've have enough green zones near our house. Second, there's secondary prevention and tertiary prevention. And it's worth investing into prevention when it comes to complications and the sustainability of the state partially depends on the prevention of diabetes. What is the connection between diabetes and longevity? It is sarcopenia, redistribution of fat tissue, and we have a lot of measures to change that. And one of the presenters spoke about metformin, which is a cheap and a very effective medication. We also have new possibilities to treat obesity, but certain medications also affect glucose level in blood. Social isolation that's related to longevity and diabetes also plays an important role. Let's begin with the prevention. Lithuania is among the leaders from the Baltic countries in this regard. We are the leaders. We do have sweetened beverage tax from the 1st of January this year. We also have a symbol of a keyhole that's put on healthy products in our supermarkets. We have restriction of sugar in our educational institutions, which prevents childhood obesity. We also have an app. It's called Nutrition 365, where people can track their everyday nutrition. 50% of our population are not aware of sensible nutrition, and they decided to create this app to educate the society. We don't have, the state doesn't cover medication for diabetes. The state promotes certain programs, and 2 of those programs are related to diabetes prevention. In Lithuania, we have guidelines for the treatment of obesity, and all doctors in Lithuania can benefit from using those guidelines. In secondary prevention, Lithuania is also a leader because all pregnant women are screened for gestational diabetes. And we have a network of gestational diabetes where people can find more information about the management of this disease and the possible complications. And we can see that pregnant women tend to look for that information that we provide. Because 10 to 50% of women who are pregnant can get gestational diabetes. We also have programs where patients, based on the risk groups, can carry out the testing. Treachery prevention, CGMs are compensated for children. We have a lot of types of surgeries compensated. We have a variety of medicine to treat diabetes and to prevent cardiovascular diseases, and we believe it's going to be helpful. We have a lot of organizations that contribute to the treatment of patients. You saw the nutrition recommendations shown by the professor earlier, And our colleagues and I also issued similar recommendations. Schools are also very important. And Lithuania, when it comes to the European Union, we do have quite a lot of measures, but there's no systemic selection and other instruments. Thank you.
Labai ačiū už gražų pranešimą ir kaip matome.
Thank you very much for your presentation. As we can see, Lithuania's positions are fairly well in the field. We would now like to give the floor to Professor Plistienė from the Lithuanian University of Health Sciences to cover cardiovascular diseases. Thank you very much. Well, first of all, the situation in this regard is not as good as is in the previous field, so I would like to speak of the longevity, of cardiovascular longevity. As we are well aware, cardiovascular diseases are the top leaders responsible for increased mortality, followed by oncological diseases, meaning that every third person in Europe dies from cardiovascular diseases, which is why the Council of Europe this year initiated a Save Hearts plan which is intended to reduce early mortality, improve prevention and early intervention, disease detection and diagnosis. The Save Hearts plan has 3 pillars focused on prevention, early detection and screening, and treatment, care and rehabilitation, all of which cover digitalization, scientific research, and reduction of irregularities. We are aware that 80% of cardiovascular diseases are preventable. 80% is a huge figure, provided certainly we focus more on prevention. Unfortunately, in Lithuania as well as in Europe, only less than 5% of the health budget is allocated to this end. The Lithuanian Association of Cardiologists is also initiating in Lithuania a national cardiovascular plan, which in combination with the Save Hearts plan, that of the Council of Europe, will focus on increasing prevention, reduction of risk factors, contributing to a healthy lifestyle, and prevention starting from kindergarten, all of which should reduce the said risk figures, increase healthy longevity, something we have been talking for the past week, maintain and contain long-term health expenses, and perhaps contribute to us becoming a regional leader when it comes to cardiovascular innovation, because the situation in general is certainly not satisfactory. Europe became concerned when it reached mortality of 34%, whereas in Lithuania, every second patient in Lithuania dies of cardiovascular diseases. Lithuania has achieved a major breakthrough, however, yet we haven't reached the EU average. However, there are actual people behind the statistics. Quite recently, we have been referred by a patient named Dainius, 43, due to clinical death, due to defibrillation. He was later resuscitated and entered the emergency room. This is the so-called widow's artery that was blocked in Danish. We call it this way simply because women end up being widows once the artery is clogged. We managed to successfully declog the artery in Danish, but what we learned in the process is that Danish was an enthusiast of longevity clinics. He was aware of the size of its telomeres. He was aware of all the existing risk factors. And his wife informed us that he was a middle-aged sportsman involved in a number of several semi-marathons. And from the analysis, we were aware that he had high blood pressure, but he wasn't using statins because he was afraid to contract Alzheimer's. His medical record showed that he was in a risk group in terms of cardiovascular condition. Were those modern supplements helping him in any way? Apparently not, because his bad cholesterol was quite high. Lipoprotein was also quite high, and it's considered to be high when it exceeds 50 milligrams per liter or 105 nanomoles per liter. This indicator shows that this is a person that was at a extremely high risk, which was not observed in due time. The reason for lipoprotein A being so risky is that, well, in the world, in Europe, there are many people that have high levels of lipoprotein A. In Lithuania, we have over 30 patients with this risk factor. It is also connected to the calcification of the aortic valve and other medical issues. We have very little research on this, and only a small amount of our population is being researched against this indicator. We always say that we should ensure early prevention. Americans maintain that early prevention should start at a very early age. If we are aware of any track record in families of the presence of certain cardiovascular diseases, children should be subject to individual prevention. And let us not forget, in Lithuania, we do have such an opportunity. We just have to make use of it. We have a unique cardiovascular disease prevention program where your risk factors are assessed by your family doctors. And if you are assigned to a high-level risk group, you will be referred to greater screening where your lipoprotein levels, calcium levels in your bloodstream will be assessed. So it is a unique program in Lithuania. You just need to make use of it. And only then can we go on speaking of the different supplements, rapamycin, and other medication, because the best disease is the one that never occurs, and the best treatment is the one that is never needed. In conclusion, I could just say that I would like to end with a few concluding remarks. First of all, we should assess the risks and do that at an early age. It must be also be assessed repeatedly by changing the different risk-related factors such as lipoprotein A. Do assess your risks against the presence of lipoprotein A. Be aware of your own risks, and the national cardiovascular disease strategy would definitely contribute to the reduction of mortality from cardiovascular diseases. Thank you.
Ačiū profesorė už motyvuojant.
Thank you, Professor, for this motivating speech. I would like to give the floor to Dr. Marius Kinčius, who's going to talk about oncology screening and early diagnostics.
Sveiki. Ačiū.
Good afternoon. I would like to thank the organizers for the invitation to speak here. The area of oncology is very relevant in Lithuania as well. Is the second cause of death in Lithuania. Every year, around 18,000 new cases of cancer are identified, and we have more than 150,000 people with cancer in our society, but sometimes the disease is diagnosed too early, and one of the most important reasons of death is prostate cancer. In Lithuania, we have 4 screening programs for cancer. 3 of them are recommended across the EU states. I'm not going to talk about our screening algorithm, the frequency of it, and Lithuania has unique programs. We started with these programs in 2006. Previously, we had 2 programs for women, and we needed 2 programs for men. But in 20 years, it is applied in all member states of the European Union. So what's the reach of those programs? According to the OECD data, we can see that in 2023, the reach of these programs was 70%, while in 2013 the numbers were lower by 15%. Cervical cancer screening coverage results show that only every other woman comes for screening. Another type of cancer is colorectal cancer, and the index is also 50%. But our goal is to reach the coverage of at least 70%. According to Eurobeat Cancer, the percentage should be 90%, and it's difficult to reach these numbers. When it comes to prostate cancer early diagnosis, our target population is between 50 to 70 years. Every year, we screen more than 100,000 men, and they are diagnosed early. These screening programs allow us to diagnose cancer earlier in first or second stage. Let's take 2 women. One of them goes for regular screenings and another doesn't. And let's say the second woman has stage 4 breast cancer, and she's more likely to die than a patient who's diagnosed with stage 1 breast cancer. In most cases, when a cancer is diagnosed early, more than 90% of people are cured. Looking at the cost, most screening tests cost 10 to 30 euros, and the treatment in early stages is up to 15,000 euros. In cases of stage 4 cancer, it costs more than 200,000 euros, and it needs to be continued. The most innovative medicines cost up to 15,000 euros every month. Therefore, early diagnostics is very important. In cases of stage 4 cancer, we lose 17 years of quality life per person, which is more than 1.28 million euros per person. And we need to reach the coverage of 70% or even better, 90%, which is highly unlikely. In 2022, the Council of the European Union provided recommendations on 3 new programs: prostate cancer, which we have in Lithuania. We will have a brand new algorithm since 2027. Another disease which is relevant in Lithuania is lung cancer. As for the stomach cancer, we have heated debate, and this topic is still not openly discussed. When it comes to lung cancer, every year we have almost 2,000 new cases. Usually they're diagnosed in late stages, and the mortality of lung cancer in Lithuania is 80%. So low-dose MRTs are very effective for men and women who are smoking for more than 20 years. One MRI is very effective, and it can help with the early diagnosis of lung cancer. So what are the obstacles? Why aren't people participating in these programs? First of all, the insufficient awareness about the programs. Therefore, we need to employ targeted media campaign, the inclusion of general practitioners. Very often people are afraid to undergo tests because they are afraid to receive a diagnosis. Education problems. There's always an issue of mental health support for oncology patients. There are logistical issues. Despite the fact that Lithuania is a small country, there are wide gaps in terms of screening coverage between different regions, and early registration, mobile medical teams could could help to solve this question. Also, there are socio-economic factors that play a role. Overall, our goal to achieve the outcome that at least 70% of our population participated in the screening programs, to allocate a budget for media campaigns to raise the awareness about these early diagnosis programs. The Association of Lithuanian Urologists are organizing a series of events every year, encouraging people to take care of their health. Improve invitation systems for people and to introduce mobile screening solutions that could reach people in the regions.
Labai ačiū už informatyvų ir
Thank you very much for a very informative and practical presentation. And now let's give the floor to a guest from Latvia, Dr. Elizabeth Argale, to speak of the quality of life during menopause.
Good afternoon, everyone. I'm Dr. Elizabeth Argale. I'm gynecologist, obstetrician from Latvia. I'm representing Rīgas Tradiņš University, as well as I'm member of Committee on Women of Menopausal Age for International Federation of Obstetricians and Gynecology. And let's start talking about quality of life during menopause. Why that matters? It matters because women do live longer, but unfortunately with worsened quality of life. And because there is higher incidence of autoimmune diseases, functional disability, chronic diseases due to many factors that determine these differences. Here you see the difference between men and women in the age groups in Latvia. And in Lithuania, it's similar. We see that now women are the largest part of our population, and they will stay the largest part of population even after 30 years. Nevertheless, we also, as a woman, spend less qualitative life. Why we have such problems in our region? Because, of course, there is this epidemiological transitions as everywhere. We have cardiovascular diseases that are extremely high. And of course, this Soviet legacy, I would say, the bad habits, and also sometimes refusing to use evidence-based medicine and suggestions. Also, we have socioeconomical inequality, and currently we are also dealing with COVID-19 effects. If we think about gynecologists, and let's say also midwife, we are very special doctors. We are the ones who say it's a girl when she is born. And then we follow throughout a woman's life. And sometimes we do age together with our patients. Usually, if we think about our profession, we're talking about menstrual cycle consultation, family planning, checkups, also cancer screenings. And if there are some problems, we set diagnose and treat women. But currently, I also see that gynecologists can be a huge help in preventing diseases and improving the quality of life. And I will tell you why a bit later. So, what are the role of hormones in women's life? It's not just about reproduction. Estrogen also has pleiotropic effects, and it modulates vascular endothelium, metabolic balance, bone metabolism, and neurological function. And of course, fluctuations in these hormones can cause systemic inflammation and metabolic changes. And now it seems very easy. If hormones are the problem, then we just use hormones. Unfortunately, it's not like that. One of my students at her final work surveyed 50 women in Latvia. Average age was 42.4 years. Most of them were educated and employed. And what was very interesting, that 70% visit a gynecologist once per year or even more often, or sometimes they visit gynecologist at least for cervical cancer screening. What that means, that women without symptoms won't go to GP. Yeah, they come to gynecologist, and that's why I want to expand maybe our role. While the situation is so tragic in Baltic states, I think everyone has to do something. Then we also asked women about their healthy habits, and unfortunately 35% were having no physical activities. And as we see here, 29% had rare or irregular activities. Of course, here we can also see that women are overweight or obese. 1/4 is smoking, and also fish consumption at least twice times per week, which is good source of omega-3s, was not that frequent. We had question about omega-3 as well, and that was not used as well. And as we all can imagine, that creates a relatively drastic numbers of women who have been died from ischemic heart disease, stroke, or hypertensive diseases. Of course, this graph is from WHO from year 2021. Then COVID also was a big player. What I also want to note is Alzheimer's disease, that's more prominent in women. And now shortly I will describe some tools that I tend to use in my practice, and actually we can do them ourselves, and we can also teach women to do it actually. One of them is SCORE, which is systematic coronary risk evaluation. In women it's especially underdiagnosed because symptoms might appear later and atypically. What is also important, pregnancy, if there are problems during pregnancy like preeclampsia and premature delivery, that could also possess a higher risk in future. About brain and aging, most Alzheimer's patients are women because they've been linked to the decline in estrogen, but also sleep disturbances and mood swings are linked to cognitive decline. And here, for example, we have a mini mental state examination. It's not the regular practice of gynecologists, but it can be used. And actually, why we cannot use it at our grandma's party, like a task we can all do, just to check her. Regarding osteoporosis, I have noted it's also a serious concern in our country because it leads not only to functional disability but also mortality from hip fractures. And here it's very important that we have to feed our children with enough milk, calcium products and D vitamin because we build our bones till age of 25, and then it only reduces. Although it's recommended to do the osteodensitometry only after age of 60, I started to do it to the woman at age of 50, and unfortunately osteopenia is present also at this age. Also, autoimmune diseases, we have to recognize them. Why? Because they create immune hyperreactivity and accelerated biological aging. And of course, mental health. A few months ago, together with my FIGO team, we released practice recommendations for the mental health. It's very important as depression increases the risk of other diseases, and we can also assess it easily. For example, I can ask you, within last 2 weeks, have you lost interest or had little pleasure in doing things? If more than half of the days is 2 points, did you feel down, depressed, or hopeless? If it's 2 points again, and in total it's more than 3, then you are a subject for further evaluation. Of course, you don't have to tell your results loudly, but be aware, and it's very easy to do. So, to conclude, menopausal transition is not just symptom management, but a focus on longevity interventions. And as many mentioned, it's mostly lifestyle, diet, physical activity, sleep pattern, stress management, and I would add for Baltics, bad habits, like quitting them. I tell to my patients that with every birthday, when they blow the candle, they have to make a wish of one good habit they will implement this year. Regarding pharmacological and non-pharmacological methods, if HRT or hormonal replacement therapy started before 10 years after onset of menopause, it can be beneficial, but we have to check if it is appropriate. And other types of non-pharmacological methods like supplements and other drugs can reduce the risk of other diseases that we encounter when we age. There are also tools, for example, this by US Women's Preventative Healthcare. Here we can see each age group and what questions could be asked or what investigations can be done. I really like that they include aspect of urinary incontinence screening. What wasn't in here was the dementia screening, but still I think it's some good tool so we don't forget things. And now, to sum up, when some years ago, ages ago, women who were doing everything were goddesses. Nowadays, women who do everything are just a woman. We do work, we have kids, we have so many things to care of, so it's really important to have another hand with the schedule how to take care of ourselves. Nevertheless, our partners, our men, who are also our friends, they don't live as long as us. And Scandinavian countries tend to be very lonely countries. So please make this as your family tradition to go once per year for something good. And yeah, so thank you for your attention. I will be very happy to see you all in breaks. And if you want have some questions or some cooperations, please just come and ask. Thank you very much.
Thank you very much, Dr. Argelė, for coming to our conference and having presentation. And toliau norėčiau pakviesti Vilniaus universitetą.
And now I would like to give the floor to the next keynote speaker, to Dr. Tomas Vaičiūnas from Lithuania, who is going to speak on the margins of healthy aging, from the search for the Holy Grail to evidence-based lifestyle intervention.
Good afternoon. Today, I would like to try to make you doubt, and it ties in with what Professor Plisienė said. It's the search for the healthy grail, the Holy Grail, and we are trying to rewind our biological clock. Is it something new? Ladies and gentlemen, I'm not so sure. This is the enigma of the 21st century, but was it the case previously? Actually, yes, in one form or another, we would always be in search for the Holy Grail or an element which could possibly make us immortal, make us live longer. The philosopher's stone, which would increase our health span, and these are old news. And for a long time, people thought that it exists, and later on, there were certain things that people believed could improve and increase our lifespan. So this is our stone of the Sisyphus, and we have exactly the same in the 21st century, but we talk about science or pseudoscience findings, and we try to and we test NAD+, we infuse ourselves, even though we are not sure about the effect of it and its levels in our blood. But we don't ask other questions. Are we assessing the risks of cardiovascular diseases? Science tries to prove certain things, but we have to stay reasonable in our search of health. Telomeres are also very much researched, and the laureates of the Nobel Prize say that telomeres are very individual, and the lengths of different telomeres in different people are different, and it's very difficult to test it. But even if you measure the length of telomeres, what should we do with it? Then people start talking about senolytics, which would reduce the oxidation stress. We talk about the regeneration of cells, about the elimination of zombie killer cells. But in many cases, we don't have clinical trials with people in the context of longevity, but we still want to believe that it might help. Moreover, healthy people start taking metformin. Amazing. It's a drug very well known for treating type 2 diabetes, but healthy people start taking GLP-1 agonists, maybe expecting that this drug will increase their longevity by 1 year. We tend to detox everything, our nails, our hair, our liver. We try to detox everything. Nature has created an amazing organ that's called liver that is responsible for the detoxing of the organism, and it works better than a pill. And so we are looking for the holy grail in terms of longevity, but we are not aware about the context in Lithuania. In Lithuania, we are almost on the average when it comes to the average of the European Union in terms of life expectancy. On the average, every third person is obese, every sixth person is overweight, but we are still looking for the holy grail. Sometimes we talk about longevity solutions that could add to your biological age improving. But there's one paradigm. Even if we have the most modern longevity protocol, but we are exposed to the risk levels of the rest of the society, it is highly likely that our death causes will be still the same, but our biological age will be lower, which is not an achievement. In Lithuania, we have good healthcare professionals, we have technologies and programs that help patients in terms of prevention, treatment. However, we fail to execute all of that. Even if we try to implement that, our healthcare professionals are helpless because people die of diseases that are the result of our own choices. For this reason, 3/4 of causes of disease in Lithuania are attributed to behavioral risk factors. If we don't manage main risk factors, we are talking about the consequences, but not about the reasons. And this reminds us the putting out of fire, the situation. And research today say that the process of longevity should be directed not to modern technology, which can somewhat help, but first of all, it's directed to our nutritional habits, and this is our movement, our activity levels. We have data in terms of children activity since 1992, and for the past 4 years, 9 out of 10 children fail to exercise every day. And together with proper diet, physical activity, and we are meant for physical activity. It shows that if we do that, and if we eliminate risk factors, if we foster our social connections and social connections together with lifestyle changes, help to increase your healthier lifespan. Does it ring a bell with the presentations that we've already heard? I think our everyday choices are very important, and this is the most important algorithm. Thank you. Lifestyle medicine can achieve great results. Take care of yourselves. Thank you.
Ir paskutiniam pranešimui pakviesime profesorių Istominą apie.
And for our last presentation in this session, we would like to give the floor to Ms. Natalia Stomina, who's going to talk about the success stories of the healthy longevity policy.
Taip, turiu iššūkį per 5 minutes.
Yes, I'm presented with the challenge of fitting within 5 minutes time limit. Now, my presentation is going to differ from the previous one slightly, because we have been talking thus far about some very specific things that are related to healthy longevity and healthy aging. We, however, have focused more on policy, less on individual efforts to do something about the issue. So speaking not from the life expectancy approach, but from the success stories across the world. So let's try and look at those and maybe copy that. So I've tried to look into the countries with the highest life expectancy and compare that with the healthy life years. I was surprised that Monaco, San Marino, and Hong Kong are in the lead. For some reason, Iceland was not in the top 5, and Lithuania apparently has still a lot of room for improvement. We know that following the COVID pandemic, our average life expectancy has dropped slightly, but we are now continuing to follow on the rising track. In the previous statistics, we didn't see no statistics demonstrating correlation between the life expectancy and healthy life years. But apparently, the longer our life expectancy is, the healthier we are. If we take a look at the longest healthy life expectancy, we see that Singapore is in the lead. Followed by Japan and South Korea. And then if we take a look at the average and healthy life expectancy, we'd see that there is a gap. This is a forecast for life expectancy in 2031. We can expect that life expectancy will increase, and the same could be said about healthy life expectancy. We heard that the formula to achieving healthy living is quite clear. We just need to opt for more physical activity, be more resilient to stress and other bad habits, and lead a healthy lifestyle, spend more time with our family because social contacts are important. However, not everything is that easy. Now, why is it so that we're not always aware of the ways to stay healthier for longer? So how is it so that a person who tries to stay healthier is dealt a blow by myocardial infarction, although the person has done everything right, apparently? Now, let's take a look at what the other countries did right. Singapore declared healthy aging as a natural strategy and has been fulfilling the strategy quite successfully thus far through community efforts, through interventions, which paid off in the end. So they've built a national program invested in prevention in early disease detection, developed age-friendly communities, integrated social services and communities. So they focused most importantly on the sense of community. Let's take a look at Japan, which has for long been known as the one that is focused on healthy aging and the longevity of societies. The island of Okinawa declared that the average life expectancy of their residents is 100 years. A small island, I had a chance to visit there, and I couldn't see any obese person there. A very strong community indeed. So Japan has integrated a community-based approach across its policies and strategies. All Old age people are active, and they are involved in such activities like regulating queues and on bus stops, in shopping centers. They are people who are working free of charge, but who feel valuable members of society. Let's take a look at South Korea. Now, what Seoul did was they eliminated a huge avenue for cars. They've developed artificial rivers where people can spend more time with their relatives there. They are focusing on their economy, on healthy aging. Let's take Spain, which has most of healthy cities in our Europe. They invested in health as a major economic growth factor and is also focusing on its communities. So to sum up where our investment should go, it's not only about the money, and we have to make sure that our funding is targeted. And we should focus on prevention, as mentioned time and again today, and on community and individual-based services, reduction of the sense of loneliness. All of that is important because distancing oneself from everyday life activities contributes to the emergence of a number of different illnesses such as dementia and others. Age-friendly environment and development of such environments is nonetheless important. So universal design in our cities, in urban areas, in our regions are important to our citizens. Long life expectancy is not the greatest achievement. The greatest achievement is to live a healthy, independent, and meaningful life for as many years as possible. And before concluding, I would just like to say that if we take a look at the healthcare systems, not only doctors, nurses, and other specialists contribute to the improvement of the system. Since my presentation is more focused on policies, let me just say that the system requires specialists who are not only medical professionals, but who also have the skills in management, in administration, and capable of applying evidence-based knowledge in practice, not only in shaping policy, but also in implementing it. Thank you.
Ačiū už pranešimą, ačiū visiems.
Thank you for your presentations. We can see there are connections covering childhood and old age. Let's go into the coffee break, and the next session starts us 14:40. Let's not shorten our coffee break.
Sveiki visi sugrįžę po kavos pertraukos.
Welcome back after the coffee break. Let's begin session 4 on interventions and practical models. We would like to give the floor to Dr. Tamara Pfeiffer from South Africa. Is she here?
Proaktyvi sveikatos priežiūra besivystinčiose.
Proactive healthcare in developing countries, utopia or opportunity.
Guests, thank you so much for the honor of presenting here at Seimas today. I'd like to pose a question to the audience. When you think of healthcare, medicine in Africa, what do you think about? What's the first thing that pops into your head? HIV, TB, malaria, infectious disease. Yeah, challenges, very much so. So these are burdens, and these burdens are real, but they are no longer the full story. Africa is not only the continent of infectious disease anymore, it is the continent of our future patients and the future workforce. It is also the continent of the future birth cohort, and increasingly, the future older adult. So, is proactive healthcare in Africa a luxury, or is it possibly one of the most rational investments that Europe and Africa can make together? So why now? By 2050, 1.6 billion people of working age will be in Africa. And by the same period, Africa's older population will nearly triple to 215 million. This is the paradox in Africa. Africa is young, but Africa is also aging. So, if we invest only in emergency medicine, we will always be arriving too late. But if we start to invest in prevention, in early detection, in hypertension control, cervical cancer prevention, diabetes prevention, and healthy aging, we are not just saving lives, we are protecting the world's next major labor force. A sick young continent becomes a fragile global economy. A healthy young continent becomes a demographic dividend. And this is why this belongs in Parliament and not only in clinics. So the old model of African health policy was built around infection, but today non-communicable diseases have moved to the center: hypertension, diabetes, cardiovascular disease, cancer, chronic respiratory disease. In fact, South Africa lost 223 billion in GDP in diabetes alone. These are diseases that don't kill suddenly, but they quietly reduce energy, fertility, productivity, mobility, cognition, and family income for years before they become statistics. In Africa, a stroke is not just a neurological event. In Africa, a stroke could be the loss of a breadwinner for an entire family. Diabetes is not just a glucose reading. It's a productivity problem. Hypertension is not just a blood pressure reading. It's the beginning of heart failure, kidney failure, and catastrophic family spending. So the question is no longer, can Africa afford proactive healthcare? The real question is, can Africa afford late-stage reactive healthcare? Across all platforms, the evidence is remarkably consistent. Prevention pays. Vaccination, salt reduction, tobacco control, HPV, vaccination, cardiovascular risk reduction, these are not soft idealistic interventions. They are some of the highest return investments in medicine. And the beautiful thing about prevention is that it's not glamorous, but it surely is powerful. A blood pressure cuff, it's less exciting than a new robotic surgical suite. A vaccine, less exciting than a beautiful longevity clinic. Salt policy, less exciting than a new drug, but these interventions are the ones that quietly save an economy. The disagreement in literature is not whether prevention works. The disagreement is, what should we scale first? The second insight is that Africa does not need to copy the most expensive parts of European healthcare, but there are areas where Africa could almost leapfrog. In South Africa, just combining integrative care saved 1.97 billion euro and added 22 billion euro to the GDP, all at the cost of $5.30 per adult per year. Community health workers are not just cheap doctors, they are the human interface in the healthcare system and real life. They know whether a patient took their medication, they know whether a grandmother has transport to get to the clinic, they know whether there is food in the fridge, and they know if a patient has stopped attending consultations because they are ashamed or broke or scared. This is data that no hospital dashboard can fully capture. The evidence shows that community-based care can improve blood pressure control, reduce blood pressure on hospitals, or reduce pressure on hospitals. So instead of asking, do we build more hospitals? How do we build more hospitals? We should ask, how do we prevent people from needing them so early? Africa already built one of the most sophisticated chronic care platforms in the world for HIV care. When HIV struck our continent and ARVs first became available, our patients had to take between 15 and 20 tablets in a very strict regimen throughout the day at very specific times. If a patient missed one tablet, if a patient was late to take a tablet on this crazy regimen, we were at a real risk of creating a drug-resistant HIV, which would be a huge humanitarian crisis. And so we developed registries, we developed adherence systems, community follow-up, supply chains, counseling, chronic medication distribution. These all exist. But now we have the opportunity to really use this infrastructure. We can use it for hypertension, for diabetes, for kidney disease, and for cardiovascular prevention. The patient is the same person. The same 55-year-old woman living with HIV may have hypertension, insulin resistance, menopause symptoms, trauma, kidney disease. But unfortunately, the health system often divides her into separate queues, separate files, separate budgets, separate donors. And that's not precision medicine, that's fragmentation. So integration is not just clinically better, it's really more humane. Now, I'd like to add a very important point, and this should matter deeply to the European scientific community. The future patient population is increasingly African, but the genomic evidence base is overwhelmingly European. This is not just an equity issue, this is a science issue. If risk scores, drug response models, AI tools, precision medicine platforms are trained mostly on European data, they will underperform for African populations. And that means that medicine of the future may be biased, not because of bad intention, but because of bad sampling. Africa mustn't be included in research as an afterthought. It must be included from the beginning, in genomics, in AI health models, longevity research, pharmacogenomics, and preventative medicine. If we look at the numbers, We can see that the share of the live births in sub-Saharan Africa was 29%, predicted to get up to 41.3% and then 54.3% by 2100. And if we really want to look at what's happening in research, look at these numbers. 87.77% of cohorts in research studies are European. 3.71% are African American and Afro-Caribbean. Now, this is the number that you see quoted. 3% of cohorts are from African origin. But it gets more detailed and worse. Africans from Africa make up 0.16% of the health data. So what should partnership look like? We're not looking for vague goodwill. We're not looking for a declaration at a conference. We want specific, fundable actions. Let's find hypertension control through primary care. Let's support HPV vaccination and cervical cancer screening. Let's finance community health workers as real workers and not volunteers. And really, to integrate HIV, hypertension, diabetes, kidney risk care together. And then to require African inclusion targets in EU-funded genomic and clinical research. This isn't charity. It's a strategic co-development because the future of medicine cannot be built on data from yesterday's populations. And the future of global economic stability cannot ignore the health of the continent that will hold the world's youngest workforce. So I'll close with this. When we fail to prevent hypertension, diabetes, stroke, cervical cancer, and tobacco-related disease, we don't save money. We simply move the bill. We move from clinics to ICUs, from health budgets to families, and from families to lost GDP. Proactive healthcare in Africa, it's not a utopia. It's one of the most practical investments that we all can make. Ačiū.
Thank you so much, dear Tamara. And now we are moving probably to another continent. Taigi, profesorė Zemfira Gadinova, Azerbaidžanas, ilgamžiškumo veiksniai Azerbaidžane.
Greetings to everyone from Azerbaijan, the land of longevity and beautiful Caucasus. Our topic for today, determinants of longevity in Azerbaijan, physiological and population-based overview. According to United Nations projections, the global population is expected to increase by approximately 40% over the next 4 decades. However, the nature of these growth will differ fundamentally from the demographic patterns experienced throughout most of human history. This shift is primarily driven by 2 global trends that characterize contemporary populations: declining fertility rates and increasing life expectancy. In other words, future population growth will not be predominantly the result of high birth rates, as was the case in previous centuries, but rather of a substantial increase in the number of older adults. It is projected that in the coming decades, the global population aged 80 years and older will become approximately equal in size to the population of children under the age of 5. It is widely accepted that healthy longevity is an outcome of the joint forces of socioeconomic, behavioral, environmental, and genetic factors. In this regard, the multidisciplinary research on so-called blue zones, in which, as shown in many studies, people live exceptionally longer and healthier lives than average, is of paramount importance. The findings of these studies could widen our knowledge on the nature of human aging, as well as on how and to what extent all these factors individually, jointly, and interactively contribute to exceptionally long and healthy lives. Longevity is a multifactorial phenomenon shaped by complex interactions between physiological, environmental, and socio-demographic determinants. Azerbaijan presents unique context for longevity research due to its diverse geography, cultural heterogeneity, and ongoing epidemiological transition. This study aims to identify and analyze the key physiological and population level determinants that contribute to life expectancy variations within the country. This study examines the determinants of longevity in Azerbaijan from both physiological and population-based perspectives, drawing on demographic data, epidemiological patterns, and existing biomedical literature. The research explores how genetic predisposition, cardiovascular health, metabolic regulation, and lifestyle behaviors contribute to extended lifespan within the Azerbaijani population. The findings suggest that longevity in Azerbaijan is not solely attributable to biological resilience, but is significantly mediated by social context and public health infrastructure. Regions with higher life expectancy demonstrate a coverage of favorable physiological markers and supportive environmental conditions. Conversely, emerging challenges such as non-communicable diseases and lifestyle transitions associated with modernization pose risk to sustained longevity gains. The findings of this study suggest that longevity in Azerbaijan emerges from the dynamic interaction between biological resilience and population-level determinants. Individuals demonstrating favorable cardiovascular and metabolic profiles tend to exhibit increased life expectancy, particularly in regions where traditional dietary habits and active lifestyle remain prevalent. Traditional Azerbaijani nutrition, characterized by high consumptions of vegetables, legumes, fruits, whole grains, and moderate natural food intake, may contribute positively to metabolic regulation and cardiovascular health. Such dietary patterns are associated with lower rates of obesity, hypertension, and metabolic syndrome, all of which are recognized risk factors for premature mortality. Furthermore, rural population in several regions appear to demonstrate relatively higher longevity rates compared to urban population. This phenomenon may be explained by lower environmental stress, stronger social cohesion, reduced exposure to industrial pollution, and greater levels of habitual physical activity associated with agriculture or labor-intensive lifestyles. The preservation of traditional social structures may also provide psychological and emotional benefits that contribute to healthy aging. With the longevity indices reaching up to 20–50% in some areas, Azerbaijan can be considered as one of the world's longevity hotspots. The individual longevity records have been reported in the country as well. Availability of such unique human resources opens up unique prospects for multidisciplinary research, both on the individual and the population longevity as a complex biomedical and psychosocial phenomenon. Since 2005, we have renewed these studies and have launched a dedicated longevity program aimed at more comprehensive study of populations with the elevated longevity indices. The cases of age 90+ are reported for in various areas of the country. The regions of their particularly high concentration are distributed unevenly. Specifically, the highest concentration of the long-living people is characteristic for Karabakh region, where the longevity index share of those at age of 90 plus in total population aged 60 plus is reaching up to 54%. Interestingly, that in Karabakh, the highest longevity indices have been reported since 1926, indicating that in this mountainous area, the longevity phenomenon has naturally, historically emerged and been fixed for generations. One more striking point is that in the latest census, the data of 2016 that were used in our demographic elaborations, the population of Shusha and other Karabakh settlements were registered not in their historical land of residence, but in the places of their temporary residence. It appears, despite nearly 25 years of life in different social environmental settings, these people have managed to preserve the biological potential, ensuring better adaptations to physical and social environments and longer life. This is a map of longevity index Azerbaijan, and you can see the different regions with longevity index persons. Longevity in Azerbaijan is determined by a complex and multidimensional interaction between physiological resilience and population-level conditions, while biological factors such as cardiovascular stability, metabolic health, and genetic predisposition remain fundamental contributors to extended lifespan. Social determinants, including lifestyle behaviors, environmental quality, socio-economic conditions, and healthcare accessibility substantially influence survival patterns across the population. The findings demonstrate that regions characterized by healthier traditional lifestyles and supportive environmental conditions tend to exhibit more favorable longevity indicators. At the same time, ongoing modernization and increasing burden of chronic non-communicable diseases present significant public health challenges that may negatively affect future life expectancy trends. Our studies emphasize the importance of integrative and interdisciplinary approaches in longevity research. Combining physiological analysis with population health perspectives provides a more comprehensive understanding of aging process and offers a stronger foundation for evidence-based public health policy. Azerbaijan, therefore, serves as an important case study within global aging research, particularly for countries undergoing demographic, socio-economic, and epidemiological transitions. Future research should incorporate longitudinal epidemiological data, molecular biomarkers of aging, and region-specific health assessments in order to further clarify the mechanisms underlying healthy longevity and population survival dynamics in Azerbaijan. These are our longevity people, which are living different areas of Azerbaijan. Most of them are women. But these are our centenarians. They also live the different regions Azerbaijan as mountainous, high mountainous, fossil and rural areas. And the end, wish all of you healthy longevity. Thank you for your attention.
Thank you, Professor. I'm not sure about my Azeri, but some kind of chok savo, something like that. Chok savo? Visą mano Azerbaidžano kalbos bagažą išnaudojau.
I ran out of it. Let's change the topic. Let's talk about something else. let's jump onto another topic entirely, which is a very interesting topic. And Mr. Augustinaite is going to talk about sustainable architecture as a means of promoting healthy human longevity. This is a very interesting title.
Kaip čia keistas skaidras? Kaip skaidras keičiasi, nesuprantu.
Esu labai tikras, bet...
Ar su šito?
Šitas.
Supratau, ačiū. Labai diena.
Good afternoon. I am Dalia Augustinaite. I'm an architect. It may sound strange to see an architect in a health conference, since healthy longevity and aging is a complex matter related not only to the practice of medicine, but other solutions related to it. I would like to talk today about some of them, and I'm going to talk about artistic solutions in architecture. You probably know that Winston Churchill once said that we are shaping our buildings and then those buildings shape us in return. What does it mean? The physical parameters of architecture, the things we see, the things we hear, the things we can smell, tactile, and others, determine certain artistic solutions in architecture, which are classified into types, into certain architecture types. And these different types affect human behavior, and they constitute this a type of technology, and they can add to the quality of life and longevity. We have 6 archetypes, and they determine the activity of a human being, starting from survival to sustainable activity that can change one's quality of life. I mean, thriving. It determines the satisfaction of human needs, whether the needs are physiological or intellectual. Every archetype and every solution has a different aesthetic manifestation. Which of them is the best? All of them are very important and all of them are equal, but the goals, their goals are slightly different. The first archetype are natural structures, and those structures are meant to ensure natural physiological needs. You can see Belmont waterfalls that you can find in Vilnius. Nature structures is something that other decisions stem from, and architecture creates conditions for people to function in the environment. Another archetype are substitutes for natural structures, and the goal of this archetype is to satisfy physiological needs via human-made solutions. For example, a lamp, or as you can see in the photo, you can see very artistic composition created by Bučiūtė. This is in the hall of our National Opera and Ballet Theatre. The artificial structures have the same function as the natural ones, but they allow for activities when natural conditions are not conducive of it. We can compare these structures to technology or medicine created by humans instead of natural medicine. Another archetype are prototypical structures. These are meant to organize physiological changes. And you can see in the photo in the Botany Garden of Vilnius, one of the buildings has a climate control system that's based on these green structures. These structures require specific abilities to design, apply them. However, these structures are related to the improving of the functioning of a human being. And a medicine-related example would be when if we want to achieve a healthy longevity, we need to create an individual treatment plan for a person. Another archetype is typical structures, and this is a repeatedly organized physiological changes. You can see an example of Gothic style, a facade, and this is the Perkūnas house in Kaunas. These structures are repeatedly implemented innovation solutions. These, if we compare it to medicine, these typical structures could be compared to Eastern medicine and Old Lithuanian medicine. Also, we have unprecedented structures which essentially change physiological activities. And during my master's studies, I proposed the idea for building complex for funerals, burial services, which was a very unexpected. But this type of structure already exists in Sweden, and this is unprecedented structures are inventions in a way. And if we compare it to medicine, we can there's an X-ray machine which changed the medicine, but its introduction into the market was rather complicated. And the final archetype is art or conceptual structures. And as strange as it sounds, these structures have to do with unpractical physiological activity that can be given meaning later. We say that art is not, it's not a practical activity, but it's a very practical tool. It is because people create different experiences for people, experiences that help to find unexpected solutions for the challenges they're facing. A medical example of that is, for example, art therapy. And in the slide, you can see a Christmas tree that I interpreted in my own way. It's built from metal net and moss. So we covered all of the archetypes, and I hope you saw their ties with medicine. And the solutions that I spoke about are science-based, and these are the findings of my dissertation. Thank you.
Ačiū, gerbiama Dalia. Labai taip netradiciškai, bet tikrai įdomi.
Thank you, an untraditional but very interesting presentation. Now, after having rested our thoughts through diversion into a different topic, let us go to another one now, one focused on toxicology and addictions. And to speak on that, we give the floor to Professor Robertas Badaras, who received 5 minutes more for his presentation. Well, I'm not sure what Saulius was expecting from me, because once he invites me to one event, it takes another half a year until I'm invited anywhere else. In any case, thank you once again for the invitation. I'm always interested in delivering presentations on topics that others find it difficult to understand, because that's when you get the most of those presentations. You know, I'm always asked about toxicology and how that affects longevity. So I was myself interested in delivering this speech. I was interested in delivering a lecture, actually up to 1 hour, but Saulius warned me not to do that. I know that once the lady stands up, I know that I have to finish with my presentation, so I'll try to do just that. I'll try to sum up my findings. Let me first of all focus on a chronic and acute effect of intoxication. When it comes to longevity and aging as a phenomenon, there is very little scientific research on acute poisoning, what is interesting is that it's connected mainly to hazardous smoke. And this is something that is considered to be a chronic risk factor. Hazardous smoke is the one that contains harmful substances, including heavy metals such as lead, cadmium, as well as pesticides and other pollutants. And so acute poisoning can be compared to being affected by hazardous smoke, let's say, when you're exposed to it and you immediately suffer the consequences. And if we are talking about longevity, we're mainly discussing chronic poisoning, where we are focused not on a single year, but on several years throughout which the effect of poisoning accumulates. We tend to cite well-known sources, and so the Global Burden of Disease study focused on pollution in 2019,
what is interesting that it looked not only into the 9 million death toll of pollution, but also to the distribution of the different types of deaths. Over 60% of them were cardiovascular deaths. I have two cardiologists at my own home, so I can tell you that if something is not proven by a cardiologist, you can say it does not exist. So in cardiological guidelines, pollution is deemed as a severe risk factor for longevity. Air pollution caused deaths, and their distribution can be seen on this map. Certainly, Asia can be singled out in this respect, but also Australia. Europe certainly does not look good in this context, but certainly regional differences are what matters the most. As for the diseases, these are usually cardiovascular diseases caused by pollution. We're also approached with a question of how does air pollution shorten our average life expectancy. According to official sources, that of the State of Global Air 2019, if a newborn is born today, air pollution will cut the average life expectancy by 20 years of the person in the end. We also have some statistics from the EU conducted in 2021. The survey revealed that 97% of the EU's urban residents are breathing an air that is filled with particular matter that exceeds the WHO permissible levels of concentration. Now, as for the changes over the past 4 years, barely no changes have been achieved. Simply because the World Health Organization's air quality standards are much higher compared to that of the EU's. According to the WHO, nearly the 100% of European cities are inhaling air that is filled with particular matter that exceeds the limits. There's also a unique study conducted on the effects of pollution on the gender of the newborns. All sorts of technologies, including AI, were used to deliver the results in the study, and the answers in the study were quite clear. The study concluded that the gender of newborns is also connected to water and air pollution. A very serious publication and an interesting one on the study. Now, we should not limit ourselves to air pollution alone. I would like to focus on some heavy metals and some industrial chemicals like bisphenol and PFASs. Let me begin from the heavy metals. There was a time when people said that focusing too much on heavy metals was a part of paranoia, but the situation has changed. 1 in 3 children worldwide have been found to have greater concentration of lead in their organisms. which contributes to behavioral and intellectual disorders in the learning processes. You can see the distribution of this issue on the map. Again, Lithuania does not look well on the map. Now, where does the lead come from? It comes from old dye. It can be found in our soils. It can be found in our packaging that contains lead, even though it is prohibited worldwide. And it also comes from lead batteries, from jewelry. So perhaps we are running out of lead worldwide. Unfortunately, it is not so. Lead production is growing worldwide. So that would be it about lead. Now let's focus on another harmful substance. This is a group of compounds that make paper water resistant. So disposable cups or packages, they use PFASs. You can also find it in dental floss, in carpets. Also, every kitchen that has kitchenware that cannot be messed around with forks, not to damage them. At least I was reprimanded about that in my own kitchen. And I eventually disposed of this kind of kitchenware from my own kitchen. In general, we should avoid the kind of kitchenware which, however wonderful it is hazardous if we damage its surface, because through the damaged parts, the harmful chemicals enter our food that we cook in it. And it can stay into our bodies up to 7 years. So this is something that we should be aware of. And these compounds can be found everywhere. And experiments with animals prove that. These compounds affect the synthesis of testosterone. It affects the reproductive function, increases mortality at birth. However, the majority of data comes from America alone. Now, how can we avoid the intake of these compounds? Well, we can avoid using kitchenware containing these compounds. We should read the labels informing us about whether or not the product contains PFASs. Among those classical substances that we should also discuss, we should also include smoking and the substances inhaled through it. There's a wonderful Surgeon General report which informs us that it is never too late to quit smoking, that it is also associated not only with health benefits but economic ones as well. My family doctor said don't quit smoking because your health might deteriorate after that. In any case, I can say that quitting smoking adds quality to life. And I'm saying this because when we talk about smoking, we speak of quitting smoking alone. We keep making examples that quitting smoking can help us become the next top athlete, but this has nothing to do with it. Smoking addiction is something that needs treatment, and quitting smoking is now even attributed to a way of treatment. If we look at our publication issued from our addictions prevention department, it informs us that the benefits of quitting smoking are exhibited right after our last cigarette, and it grows with time. If we believe what the Surgeon General report says, quitting smoking is also related to improved quality of life. The World Health Organization stipulates that the benefits of quitting smoking can be felt once we finish with the last cigarette, but we also gather statistics on what happens with time following quitting smoking, and all of that shows the benefits of quitting smoking. Another important factor, I was fighting against my inclination to speak about that, but electronic cigarettes. These are a mixture of nicotine and batteries used in one place. Where can we dispose of these batteries there? Because we don't have just the recycling containers available for them just yet. According to the latest diagnostics, we have 1,050 new substances registered. And we can see how many of them remain on the market since they emerged on the market. We have about 400 psychoactive substances used by Generation Z, reducing its life expectancy since childhood. And if we look at diagnostics in Lithuania, we have wonderful diagnostics equipment, professionals working in the field, young people, grown-ups, working with the millions costing equipment, but there's no actual activity thus far in the field. It seems like we are artificially working in a fenced environment, in isolation. But diagnostics is important for longevity because it can give us more information about the existing situation. And my takeaway to you would be is that the effects of pollution on public health and healthy aging is insufficiently assessed just yet. Professional diagnostics and the lack of it is raising a real threat to the health of our citizens. As it has been said by Paracelsus, that all harmful substances cause severe risk to the health of each and every one of us. Thank you, Professor. The time that you had was definitely not enough to explain to us the reasons for shortened life years of ours, but we will listen now to Mr. Yuri Ostrinsky, who will tell us about targeted physical activity.
Dear distinguished guests, it is an honor for me to present in this country-wide event, which is the first in the world. And really well done, dear Lithuanian people, because you are addressing the issue of health longevity very strictly and very toughly, and this is a good way. Now, we have been scared by our previous speaker that everything is we cannot avoid breathing, drinking, and the world around us is quite complicated. But I have maybe some better news about the sources of our healthy longevity, and we can feel them in the hand. So if I would ask from you to take your right hand, and to put it just on your belly, under your, on your stomach, yeah? So, you feel it? Good. So this is actually, you hold right now maybe a source for your healthy longevity. So the healthy longevity maybe start in the gut, and I will explain in a few words how and why. So the previous idea was not entirely mine. So as you see, long before me, the Hippocrates mentioned that all diseases begins in the gut. And later on, a great Elia Mechnikov also mentioned that intestinal microbes and their poisons reach the body and bring it harm. So in our time, we see that those ancient insights are quite right, and maybe are also the source for the healthy longevity. So this is my one of the favorite slides, because it is directed to you, to decision makers, to the politicians. You see that healthy life expectancy differs so much from the life expectancy. Here in Lithuania, you are doing much better than in Latvia, the place when I am making research right now. On the other side, we see that in Israel, the origin of mine and my hospital, Sheba Medical Center, we do much better. But in any way, no matter how we live, the last 10 to 25 years of our life, we are sick, ill, suffering, and it's not only our problem, this is also a problem of the economy and of the society. I'll just give you some numbers. If your country, and I hope that you will do so, will manage to extend the healthy lifespan in only 1 year, so the overall return to your economy will be at least 10 billion euros, maybe more. So it's worth to invest this. And the thumb rule of the economy of health is €1 that you invest to the prevention, bring back to your economy at least €50. So it's a very good business, yes, and a very good reimbursement. And when we ask ourselves what makes us so much suffering and sick, so we can see that most of the sources of the bad years are actually the cardiovascular diseases, the type 2 diabetes, dementia, cancer. And when we ask ourselves what is common in those conditions, so they all share the inflammation, but not a strong inflammation that we fear from, but the low-grade systemic inflammation, which you cannot feel, but you can detect. So, inflammation, low-grade systemic inflammation, we call it inflammaging, inflammation plus aging. So this is really not something that we feel, but we can detect, and this is a low-burning fire which triggered in our body somewhere around mid-age, 40, sometimes earlier, and it triggers and starts all of the systemic diseases like cardiovascular and many others. When we ask ourselves what is the reason, or what is the source of this low-grade systemic inflammation, there are a couple of them, but it seems to be that one of the most significant triggers or pathways is the gut dysbiosis and impaired intestinal permeability, or what we call in the simple language, a leaky gut. So, it all starts in the gut, as I started from. The gut or intestine has a border. Yes, we are all in the region are quite scary from our eastern border, right? And you invest a lot in protecting this border, investing significant money, but we have to invest our attention to our intestinal barrier. Intestinal barrier, this is a simple one layer of the cells which separate the internal gut content, yes, microbiota and remains of food, from the inner body, yes, our internal environment, which should be sterile. And when this border is damaged, and the main stress factor for this damage are bad dietary habits, stress, excess use of medications. Yes, too much antibiotics or non-steroid anti-inflammatory drugs, which are so much popular in our time, so they can damage if we take them uncontrollably. So we open this board and we receive the content of our microbiome into our body, and our defenses, our immune system start to fight against them. So we also, as I have mentioned, the microbiome, the huge population of the microbes which lives inside us. And when I say about huge, so it's really huge. It's 40 trillion microbes. It's more than stars in our galaxies. So when they come into interaction with our immune system, so the problem begins. Because we start the, inner fight. Our immune system fight with our body. And this is a very bad news. So we want to ask ourselves what to do. Yes, what to do, a simple question. If we want to make things better, so we want to address how to protect our gut, how to protect and improve our impaired intestinal barrier. Many of you spoke about physical activity. Physical activity is good, but what is the physical activity? General peer for everyone? No. So we have conducted an idea of the targeted physical activity. Yes, the physical activity which target your intestinal barrier or leaky gut. And the problem that, as I have mentioned, stress ruins this barrier, bad conditions causes the lack of the blood supply to your intestine. So let's try to rebuild it. Yes, let's make the sanatorium to your intestine. Like some of you will come tomorrow to Ergle. Yeah, you have a wonderful place. But let's do it to our gut as well. So we conducted abdominally targeted physical activity as simple movements, simple exercises, simple breathing, which is directed to restoring the problem of our leaky gut. And we addressed it on the very scientific way. We conducted a research because we want to be sure that our ideas are the right one. So we started from the inflammatory bowel disease, Crohn's disease. Some of you maybe have heard about this. And this is an inflammation of your intestine. We created these specific exercises for those patients who suffer from this disease. And we have surprised to see that they are getting better. They are improving. And not only subjectively, but also the inflammation markers went down. And then we started with, in Latvia already and in Israel, the study on the fibromyalgia. Fibromyalgia, this is a very serious disease with a lot of people affected. And we also have achieved a remarkable results that those patients who have made these abdominally targeted exercises, they started to feel much better. And we have observed a huge changes, positive changes in the biomarkers, in microbiome. Yeah, we have shifted microbiome because microbiome can also be a trigger for the inflammation inside us. And then we have tried this also in the average adult person like you and me, 40-year plus, which holds this so-called inflammation phenotype, or people like us, in the risk of cardiovascular diseases. And those people who have made these abdominally targeted exercises, they also have started to feel better. So when we think what to do next, this target for the leaky gut is enormous. Yes, we can see that heart and metabolic diseases, immune and autoimmune diseases, brain, mood, aging, and frailty, all of them has this phenomenon of leaky gut. And I would be really glad if I would have some magic pill that restore the normal intestinal permeability. But before that, we have a really good tool that, first of all, calm down this inflammation. And if you want to make it more practical, so first, do not harm. Have a good food. Make it less stress. And if you are in trouble, and most of us are in trouble, so maybe this specific targeted exercise can help you. So before I end, I would claim that health and longevity may begin in the gut. And ačiū ir būk sveikas.
Thank you, colleague. Paldies, tada Ir dabar norėčiau.
And now I would like to give the floor to Ms. Kristina Nemaniūtė-Gagė, who's going to talk about a profession that's sometimes ignored, and she's going to talk about the role of the pharmacist for longevity. The floor is yours.
Good
afternoon. I cannot see my slides. Look there on the screen. Everything's fine. Okay, so hello everyone. I represent the Lithuanian pharmacists today, and judging from the previous presentations, I can say that I believe that everything will not end with just good words, but it will be translated into good deeds in the end. We talked about the failure of people to participate in preventive screening programs, and we speak of chronic diseases and that we're unable to address them because we fail to attend screening or preventive programs. So where does the pharmacist come into play here? When it comes to the control of chronic diseases, that's where pharmacists come into play. And let me tell you about some of the countries against which we are lagging behind. Now, is our society ready to pay attention to what the pharmacists are telling them? According to our surveys, people tend to trust pharmacists. They are not only relied upon, but people also trust in their competence, in their know-how. And they would like to see pharmacists playing a greater role in their health management. Now, what kind of services would the residents expect to receive in the pharmacies? And this is something that is also taking place in other countries, such as vaccination, testing, and so on. Based on the situation in other countries, we see that pharmacists are the ones that are interfering with the prevention, that are interfering in the disease management process. They are involved together with doctors in the disease management process. Now, Lithuania does not look well compared to other countries. In Lithuania, we have only in Lithuania, our pharmacies are able to provide only 5 services in total, compared to other European countries that provide more services there. And this is mainly related to the issuance of medication, limited vaccination, limited non-prescripted medication, working 24/7, and collection of outdated medication. Now, the people that contact pharmacists, they are usually the ones that may not necessarily go to see a doctor with a certain issue. And we see the necessity of our pharmacists to be used as those that would encourage other people to participate in preventive programs, something that is being done right now by doctors only. As for the vaccination service, doctors are the ones that are encouraging people to get vaccinated, and our pharmacists have only a limited capacity to do that. Health literacy is an area where both our pharmacists and doctors involved. However, when it comes to the consumption and the monitoring of
consumption of medication is the area where neither the doctors nor the pharmacists are involved, nor any other experts, medical experts in the field. Now, this means that no personal healthcare specialist is involved in monitoring the treatment process of a patient. There's nobody that is aware of whether or not the patient is using medication, how it is being done, how effective their consumption is. And the medication is not effective if it is not being used. We have a lot of documents showing that it is not enough for the patients to get the medication alone. We have a lot of stories where our patients get the medication at our taxpayers' money, who say that they simply get the medication because the doctors prescribe them, but they don't intend to take them. 30% of our patients quit sticking to their treatment regime 10 days after the issuance of the treatment, and 25% of them quit doing that 30 days in. We've conducted a survey in our country on the medication that the people have at home, and apparently 36% say that they still have some medication left in their homes, one that was prescribed, and they failed to consume everything that they were prescribed. So apparently we still have to speak about young patients and chronic diseases, because young people are the ones that are prescribed medication. They try it for a few days and the remainder of the prescribed medication is left on the shelf behind. This is an expensive issue too. We don't have any research into that, but if we look into one conducted by WHO or the European organizations, we can say that discarded medication or not used medication accounts to a huge budgetary burden, funds that could be used elsewhere. But more importantly, it is related to the failure to preserve life. The mortality in patients who use medication that is prescribed compared to mortality in patients that fail to use prescribed medication is lower. So we have 300,000 of deaths that could have been avoided if the medication was consumed as prescribed. So prevention is something that helps to prevent disease. Vaccination prevents infection, and failure to stick with the treatment regime is what causes complications and comes at the expense of lives lost as well. So how can pharmacists play a greater role? Pharmacists are the ones that are mostly contacted by residents, that are most trusted by our residents, as seen from the previous slides. When the pharmacies during the pandemic were considered to be as the ones issuing passports, opportunity passports, there were thousands of people that contacted pharmacies as their first contact points. So this was the contact of the points of first contact. Pharmacies are the ones that could ensure timely referral to doctors, the ones that can monitor the treatment process. And we've also observed that doctors can ensure better treatment results
and in general, the cooperation between the patients and pharmacists is necessary to make sure that our patients stick to their treatment regime and use the prescribed medication. If we had such specialists, the situation would be different, because so far we don't have any specialists working on the monitoring of treatment. So if we want to ensure better longevity, we would like to see a greater involvement of pharmacists in the future, because a lot is being said, but very little being done in the field. Thank you.
Ačiū, gerbiama Kristina, tikrai įdomus požiūris.
Thank you, Christina. This is a very interesting approach. We don't think about it all the time. Moderators, you can. You have 2 minutes for reflection each. Professor Badra said he has a political insight. Actually, my understanding is very simple. We need to be physically active, respect our microbiome, respect pharmacists, and take into account the benefits that our architecture can offer us. And of course, on my behalf, I would like to say that Lithuania must have at least one laboratory that in researchers toxic substances. Healthy life, longevity, increasing indexes that are included into directives. And we see the improvement on the paper, when in real life we don't see those positive changes. For this reason, we need real action to improve the lifespan of our people. Yes, of course, we need to respect doctors and pharmacists, but the most important thing is to prevent illness, and we need to promote healthy lifestyle and disease prevention. We had a series of events in the Seimas, but we still haven't reached the agreement how to improve the activities of community health centers, how to intensify the prevention, because the disease treatment is not a solution, and it does not have to do with healthy life. This is the real intervention, and I'm grateful for the organizers, especially Mr. Saulius Čaplinskas, for talking about prevention. I hope you will continue your work. And since I'm allowed to speak, when we talk about a variety of problems and the complex phenomenon of longevity, we tend to remain closed in our social informational bubble. Two previous speakers showed me that there's so many things I don't understand, and there are so many things that we don't know, and these experiences expand our understanding. So thank you for doing that.
Nu ką, tai gerbėmėjai, pereinam prie paskutinės sesijos.
Let's move on to session 5. We will be finished by on time. When it comes to dinner, there will be no misunderstandings. Laura, the floor is yours. Let's invite our speakers. It's great that we see so many of you here. In the audience, su mumis Silvija Valdonė Alšauskė, Insights from Clinical Practice and Prevention Day. The floor is yours.
Labą dieną. Ačiū už pristatymą.
Good afternoon. Thank you for the introduction. I think that most of you think I'm a student, and I will be like a student. And I don't have a slide, and I prepared my speech last night. It's an honor to stand in front of you and to talk about a topic that we started addressing 3 years ago. It was an exotic topic, and it's longevity medicine. I work together with Ilona Lukiševičiūtė-Noreikienė. She's here in the hall. We work together hand in hand with her. We started our journey in 2023. On the 8th of December, we had a small conference on Healthy Longevity Medicine 2023. We raised the question whether it could become a future vision and a part of everyday medical practice, and I can say today that it can be. In 2025, we had Longevity Medicine in Today's Medical Practice conference, where we spoke about molecular biology, microbiome, individualized medicine, and just a few days ago, we held a big event. It was an international conference, Longevity Forward 2030, which started the Longevity Assembly Week. The discussions spanned across all Lithuania. We observe changes. At the beginning, we spoke about longevity medicine being more than just supplements. We talk about science-based, prevention-oriented, individualized medicine that is based on knowledge of a variety of fields. In our events today, focus on medical professionals, but not only doctors, but also for nurses, lifestyle medicine specialists, medical psychologists, and others, those who can apply that knowledge with their patients the next day. And in this area, responsibility is very important. As Professor Valius said, it's important to distinguish between what is science-based and what is commercial promises. We live in information overload. We have AI, we have social networks, and we need to understand that information is changing all the time. And during the opening of this conference, I like the ideas by Professor Ignatavičius. If we do have knowledge about the process of aging, we need more scientific evidence. And this is not a weakness. Ladies and gentlemen, I would like to address members of the Seimas. We need your participation in that. We can host conferences, we can talk about it, we can learn, we can teach our colleagues about personalized medicine, about everything that has to do with longevity medicine. This is the current science. But if the system is lagging behind, that knowledge is useless. And I would like to talk about family medicine. I'm a general practitioner, and general practitioners are the first contact of patients, and general practitioners sometimes even know the pet names of their patients. They're so close. And general practitioners can talk about prevention when changes can still be made. But today we ask more and more from general practitioners. Doctors still focus on documents but not on patients. And this is not a doctor's problem. This is the systemic problem and the problem in legislation. And if we want to implement individualized medicine, we need to allow our doctors work. If we want our daily practices to improve, the system needs to encourage that. Longevity medicine doesn't ask for miracle resources. It asks for space. It asks for time so that doctors have enough time to talk with their patients. Of course, the legal framework needs to be adapted to the current science. Academic society, doctors, we are working on that. We are talking about it with our colleagues, but now we are asking for partnership. We need legislation to support this approach. Thank you. Thank you. This is a very good speech. I hope we'll listen to the speech on YouTube later. Thank you for your enthusiasm. Well, what we've just heard, there are people who represent their area, who work in promotion, and we talk about individualized medicine, about the science of longevity. The second speaker, Professor Limas Kupčinskas, apologizes for being absent today. He prepared some information about the Academy of Science. And in the Academy of Science, we spoke about what science knows in terms of our longevity and the gaps in our longevity. And those who are interested in this area, the science, the scientific news and perspective, you will have the opportunity to watch a video recording which will be in the English language. I promised you we would finish on time. Let's move on to the second presentation. I would like to invite Ms. Claudette Buttigieg from Malta, and she's going to talk about perspective on the promotion of healthy aging. The floor is yours.
Okay, so I was just taking it slightly easy until I started realizing that the previous speaker was not going to be here. So I prepared a speech, but I'm not going to use it because I'm picking up on so many things I heard today, and I'm a bit of a practical person, and I think we should start now seeing what we're going to do with all this incredible information we had today. So first of all, Solus, thank you so much for the invitation. Thank you, Sir Michael Hurst, for getting me involved in the Parliamentarians for Diabetes Global Network, which is PDGN. And I'm here because I'm a former member of Parliament. I'm also here because, like Sir Michael, my daughter has type 1 diabetes, and she was diagnosed at the age of 6. And when I became a member of Parliament, I realized that this was my call. I had to do something about it. Now, what I did in my country, you can do in any other country, including here. And from what I heard today, I think you have the groundwork to actually do so much. So this is PDGN in Malta. I encourage you to go on the website, find out more what we do as parliamentarians, okay? But in a nutshell, we are the world's first and only global network of parliamentarians with an interest in diabetes, okay? And we do it because we love it, and we do it because we have personal reasons, and we've encouraged others who do not have personal reasons and have joined us. And I'm very, very happy to be part of this organization. This is a proud moment for me back in Malta when we met in my country, a small country which kicks above its weight, but which has a high prevalence of diabetes, okay? So in a nutshell, this is what we do. And if you want to find out more, please go on the website. But reach out to us. We have forms for you to fill and for you to become members of PDGN, and the more the merrier. And there goes Michael taking out the forms right now. So as policymakers, I've heard this today. It came up in several speeches, including my friend Sandesh. I'm saying we have to ask uncomfortable questions. So this was said today several times. Are we adding life to years, or merely years to life? And from what I've heard today, that could be the parting point. We want healthy aging, but we want people to function well. We want people to have dignity, to have meaning and independence. And these are statistics. We've seen a lot of statistics today. I'm not going to ponder much on them. But as you can see, diabetes plays an important role around Europe. It's a disruptor, okay? Especially the curve goes up with age. So, you know, really obvious what's going on there. So some more statistics. But why am I here? I'm here because back in Malta, we did something which was an initiative by the leader of the opposition then, Dr. Simon Busuttil, who brought with him from the EU an idea which really, really worked in my country. And I encourage each and every one of you to do this in your country. We did a cross-party parliamentarian collaboration, and it works, okay? If you're in opposition, it can work. If you're in government, it will work, okay? But the whole idea is that instead of sitting in a parliament opposing each other all the time, we need to find what is the common good of what we are doing. And today, I heard so many messages which come across, and I've scribbled them all over my speech, okay? So some of you spoke about choices. In the very beginning, there was a talk about why aren't people listening when we call them out to, you know, to do their screening, etc. Why aren't people aware of what is happening? I believe it was the Vice Minister for Social Security who mentioned it. And we need to understand that. But I think in the first panel, the best person sitting there was the Minister for Finance, because it's a lot about money. It's not all about money, but it's a lot about money. Now, what the Minister of Finance needs to understand is not what the cost of what is being done is, but what is the cost of not doing what needs to be done. That is the real cost. And I believe somebody later on in the day actually brought this up, okay? I'm not sure if it was the lady from Germany, but somebody brought this up today and said, you know, the cost of screening is so much, but the cost of morbidity in a condition at a later stage is so much more. So it's you know, so logical and so obvious that, you know, we shouldn't be waiting to do this. Now, I know that in the room there are people from what we call civil society, and you're my favorite people in this room because you have an important role to play, okay? You are the ones who have to put pressure on the politicians. I would have said until a few months ago on people like me, but I'm no longer a politician. But I'm here to tell you that you have a lot of power. I've just visited your parliament, and your parliament is very similar to us. The chairs at the top are where the people sit. The parliamentarians sit at the bottom. It's the people who look over the politicians and not the other way around. And that is significant. And when you go in there, and you should go in there, and you should go and follow to make sure that your parliamentarians feel the pressure and look up and say, oh, there are people watching, not just on camera where I will look good, but there are people watching to make sure that I'm keeping my promise. And people who run NGOs, people who work in civil society, people who advocate for a cause should be there and should be doing exactly that. And if you do not have the right service, you should be fighting for it. And if you need technology, I mean, I can never stop praising Dexcom for all they've done. In my country, it has changed everything. My daughter's life has changed completely because technology is giving her the possibility of living a much, much more normal life than what it was before. I don't have to worry, you know, if her blood glucose is low. I just pick up my phone and I can check. Right now, from Lithuania to Malta, I know that her sugar was slightly high today. There you go. I don't need to call her up and pester her. I can see it. Now that is, and I'm going to go back to one of my favorite interventions today, and that was Alexander from Germany. I loved what you said, Alexander, about the right to have a good, healthy service, okay? But rights have obligations, and that is the crux. We cannot go about waving a flag, I have a right to do this. Somebody has the obligation as well to do something else. So it's not just about rights, but I still think yours was one of the favorite speeches. Okay, so in a nutshell, how am I with time? She's still sitting down, okay. So in a nutshell, it's bringing together parliamentarians from different sides of parliament, and I'm sure this is going to be taken up. In the presence of civil society, in the presence of experts. We've heard so many experts today. These people need to go in parliament one by one, not more than 2 in a session. And the parliamentarians need to understand what they are telling us. But then you need the other experts. And with all due respect, it's the real experts. It's the patients and their families and the people who cannot afford to buy things which other people can afford to buy. That is the crux of it all. Okay, she stood up. So these groups can really work. They can be formal or informal. In the Parliament of Malta, we have a formal health committee. But when we had the informal diabetes committee, we put a lot of pressure. And what do these lead to? They lead to policy, they lead to strategy, because everybody feels comfortable, real KPIs, and, making sure that the politicians who promise something are going to deliver. And simply because if they don't, you will not vote for them, so they will do it. So I'm trying to remember who said this, but somebody said good words. We have to move from good words to good deeds. Somebody said this. I'm trying to remember. Was it you? I don't know. Anyway, so my 2 cents advice. Set up parliamentary groups, involve the experts, involve the real experts, make sure you have real KPIs, and make sure that politicians keep their word. And the question they have to answer is, what is the cost if we do nothing about it? Thank you.
Thank you so much. Thank you so much. Yes, and now I'm inviting Jona Bartal from Israel. Sveika, ilgamžystė. Mes turime naują žodį. Taikos ir inovacijų variklis.
Good afternoon, everybody, colleagues.
Healthy longevity is what we're going to focus on right now. Sveiki, nesu profesorė, esu Jona Bartal. Džiaugiuosi galėdama dalyvauti čia šios dienos renginyje. Man teko didelė garbė dirbti šalia prezidento Šimono Periso ir stebėti puikaus modelio vystymą su juo kartu. Man teko taip pat dirbti greta jo. Net ir būdamas 90, prezidentas buvo aštraus proto. Pasaulio lyderiai kreipėsi ne tik iš pagarbos, bet...
Here is wisdom. President Bill Clinton once told me, Jona, I hope to reach Paris age and function as he did, and that not merely a compliment, but aspiration. From this unique vantage point, I can say that longevity is not only a scientific field. It is a mindset, it is a way of life. Israel is a nation of extraordinary innovation, has moved far beyond a traditional technology into that what we truly called the startup of life itself. We see here in Israel a unique integration of cutting-edge industry, world-class academy, and the government that understand the urgency of this field. Longevity in Israel is not just research. It is a full ecosystem aimed at extending not only lifespan, but life quality. Only recently, I'm the head of the Global Friend of Paris Center for Peace and Innovation. Only recently, I had the privilege to lead a special conference on food innovation at the Paris Center, an initiative focused on developing solutions that do good for you, for the people, and for the planet. This is exactly where the future of longevity lies, at the meeting point of nutrition, sustainability, and advanced science. I remember deeply a moving visit of President Joe Biden following the loss of his son to brain cancer. Out of a profound personal pain, he turned to us and suggested advancing join large-scale research in this field. Why Israel? Because of our unique advanced medical big data. Built on universal healthcare system that serves every citizen, from babies to adults, to elderly. This allows us to identify long-term health patterns and lead global innovation in preventive medicine. This is crucial, the big data. The numbers speak for themselves. Despite investing only about 7.6% of our GDP, it's very little. It is actually the most lowest in the developed world. Our life expectancy is at 83.8 years. This is no coincidence. It is the result of systematic efficiency, preventive care, this is very strong in Israel, and of course primary medicine, and culture that gives priority to health and responsibility. But the real story is not only how long you live, it is how well you live. Today, leading medical centers in Israel are already developing tailor-made longevity program. It became very popular in Israel. Universities are combining pharmacology, nutrition, and behavior science into special program too. What was once a niche scientific field, it's now becoming a global cultural movement. Nevertheless, we are only at the beginning of this journey, and there is still much more to be done. I would like to take this opportunity to express my sincere gratitude to the Lithuanian Parliament for the honor to speaking here today. It is also a deeply personal moment for me to share that I was born here in Lithuania, in Vilnius, and that on previous visit, I had the privilege of being a guest of your presidency and to host your president in Israel. A special thanks to you, Mr. Shaoulos. You are really a saint with longevity. The only parliament that deals with this issue, such an amazing event. And a special thanks to you, Ilya Stempler. He is a driving force leading the field of longevity in Israel with such energy and vision. Our message to Lithuania and to the world is clear. We do not keep our knowledge to ourselves. Israel extends its hand in partnership toward collaboration that connects science, technology, and humanity. I warmly invite you all to come to Israel and to be our guest in the Paris Center for Peace and Innovation. And now I will leave you with an important message from Shimon Peres about life. Just a moment, I'll show you. I need help. No. Okay, this. Okay. So don't just be up to date, be up tomorrow. Always choose to be an optimist because optimists and pessimists die the same way. So live differently. Wake up every morning with a sense of mission and never forget, be a person for people. Thank you very much.
Thank you so much.
I understood that we will need to organize charter race to Paris Center, yeah?
Taip, ačiū labai pranešėjai. Ilja, we would like to invite you here. Together, we will sit here. O mes čia visi labai prašau dėmesio čia.
And as for the rest of us, ladies and gentlemen, apparently we have some time for a debate. So if there is anything left unshared, maybe somebody wanted to ask a question or add to what has been said, this is the time to do that. We do have some documents that we have drafted, and they identify some of the key aspects, such as science-based policy, healthy lifestyles and physical activity, strengthening mental health and cognitive function, prevention throughout the life course, data science and innovation-driven policy making. So, ladies and gentlemen, in front of you, you have drawers containing microphones in them. So should you be willing to share your ideas, maybe add something to those 5 points on our document, this is the moment to do just that. So anything you would like to share right now, this is the time to do that. Yes, please. Mr. Liucijus Ambraška.
Reikia, kad degtų raudona knopkė
Make sure the microphone is on. Press the button.
Labai malonu čia.
It's a pleasure to take part in this event. I'm grateful to Saulius for personal invitation. My email received a personally signed letter from Mr. Čaplinskas inviting me here. So I hope this is not the last conference of this type today. As an infectologist, I would like to say one more thing. I hope that in the next conference, we're going to focus on vaccination throughout the lifetime and its input and contribution to longevity. Thank you. I don't see Laura in a odontologist who said that she was missing dental experts in this conference as well, because apparently this field is also related to healthy longevity. So anybody else willing to share their ideas? I'm looking for hands being raised. Yes, please. And please introduce yourself if you can. Hello, my name is Modestas. I represent an organization of the elderly. We provide services at home for the seniors. We focus a lot on socialization and medical assistance for the seniors. We've heard some notorious statistics on the failure to participate in prevention programs, so we will definitely take note of that when it comes to our work with our seniors. Now, Laura, if I were to add something to our memorandum, I would say that if we live up to what is written there, that would be just super. We don't need to do anything else but for the tasks that we have already set ahead of us. As a non-governmental organization, we're definitely willing to join your efforts, and we would just like to remind our politicians that they need to keep up with their promises, and we would like to commit to doing just that if you're not intimidated to embracing us too. Well, everyone is definitely welcome, and I could say it vocally. I see Ms. Augustiniene is present here. Yes, please. Good afternoon. Victoria Montvilienė, Third Age University. I'm grateful to Professor Čaplinskas for a wonderful event, for a wonderful conference. This was a true inspiration, motivating us to put more efforts in the future. Our university has 12 faculties where we teach over 3,000 of our seniors. And I have to admit that I was inspired by a number of different keynote speakers. We will continue with our work that we have been doing. Keep up the good work, seniors. Yes, please. My name is Meda. I represent an NGO, and I would just like to support the representatives of the NGOs in saying that as an organization working with the advocacy of plant-based nutrition, we will definitely contribute to your efforts in promoting plant-based diet, and I believe that the NGO sector would definitely like to get engaged in promoting the different preventive programs. Once again, thank you, Professor Čaplinskas, for the qualitative and interesting event. Thank you.
I'm Liuda from Institute of Hygiene. Thank you for the conference. We covered a variety of topics, but I missed the prevention of trauma. And what is your explanation for that? Thank you for mentioning other topics. I'm surprised that no one is criticizing us for covering too many topics. And I was insisting on 10 minutes and not 11 minutes, and I was pushing, sticking to the schedule. Yes, certain topics were not covered, not because we think they are not important, we simply ran out of time. That's one thing. And the other point is that we had to respond to the needs of our foreign guests.
To make possibility to speak for all of foreign guests. Pirmiausiai norėjos, kad visi užsieniečiai turėtų galimybę.
We wanted to make sure that our foreign guests had an opportunity to talk here, and we wanted to include them very much into our in our conference. We tried to create our program in a way that creates that, and we can create, we can compare the things that our experts say with the things that our foreign guests say. Irena Pivoriūnienė is calling for. Yes, we have a lot of topics, and I'm glad that you are very open and you say what you missed. Inglina. International Social Academy. Mr. Bajoriene, I'm working in this area for more than 30 years. I would like to thank Professor Čaplinskas that he started working on the system regarding older people. I see continuity in your work, but NGOs need to help and translate these things into action, into municipal level. We do need to create the practical path for the good job that Saulius has already done. Ingrida from NGO working with children. We thank the organizers of the conference. We see 4 topics: innovation, science and synergy, creativity and networking, and what was said by one of the colleagues, the emergence of a scientific laboratory in Lithuania, or at least in the Baltic states. I'm Pranas Šerpytis, a cardiologist from Vilnius University Santaros Clinics. I would like to thank the organizers. I thank personally Professor Saulius Čaplinskas that you managed to invite speakers, so many different speakers from abroad, and we heard a lot of presentations. NGOs were also invited, the academic community was invited, and this area is very important. And I'm glad that this event takes place in the Lithuanian parliament. And you also invited our ministers so they can hear us. If we want to do anything, we need to invite public authorities, and we could be a united force that could help move this area forward. Thank you. Thank you. I liked what Professor Sonata Jarmalaitė said, that a word that is said in the parliament is very well heard.
Thank you very much, Laura. And once again, I join the thanks to Saulius for what he has done. I want to emphasize again that we are witnessing an historical event. It's the first time that an international parliamentary group for health and longevity is established. There were earlier parliamentary initiatives for health and longevity on the national level in Israel, in the UK. This is the first international longevity initiative. So this is tremendously important. The MOU, the Memorandum of Understanding that we developed as the basis of this parliamentary initiative will pave the way toward developing policies and implementing policies for health and longevity. As the previous questioner said, we do need to involve the government, the parliamentarians, and this working group, this parliamentary initiative will pinpoint and will address the major policy areas in the healthy aging field, including research, including data standards, the evidential criteria, including the ecosystem development, including the societal determinants. Basically, we want these therapies to be accessible to all the people and not to a selected number of people. But it's extremely important to involve politicians, parliamentarians to make these therapies accessible. And also very important, no less important, is the development of education in the longevity field, developing the workforce that will be able to address the aging society. There is a huge lack of workforce in this area. Qualified workforce. On the other hand, we want to educate the public. We want everybody to become an ambassador for health and longevity. We want to create a public movement, because from the public movement also the parliamentarian will be involved. So once again, I congratulate all of us for this establishment, and I look forward to its continuation and bringing real impact, real benefit for the people in Lithuania, in Europe, and throughout the world. Thank you very much.
Nuostabu. Ir čia šalia
Wonderful. And as we've just heard Ilya, I would like to listen to an Estonian representative, Mr. Lutsar.
Maybe from your place as well, you can...
Ms. Lutsar, you can also speak from the place you are sitting, because the microphone is available there as well.
Oops. Ria, can you share your opinions, what you are feeling here, what you are, I know, can advise for Lithuania?
Okay. It's not me. Thank you very much for inviting me. It's certainly not me who should advise. I'm by training pediatrician and clinical microbiologist in future life. So, but I, being a member of Estonian Parliament, I certainly recognize the importance of aging society. And in Estonia, very often the aging society is presented, this is a huge problem. We don't know what's going to happen, the society is aging. But very rarely you hear the words, but this is actually privilege. These aging people have lived here longer. They have some experience. Not everybody 60 plus should sit in the front of TV and watch soap operas. We could use these people. They are experienced. Their brains are working. So I think that the society needs to move, at least Estonian society, needs to move from the issue, huge issue of aging society, needs to move that this is privilege. We need to use these people in the family and in the society. Also, we see in Estonia that the families are separated. Grandparents here, grandparents in the middle, and then young families coping somehow by themselves. So thank you very much for inviting, and there's a lot of things to think about. Thank you.
Thank you so much. Ačiū Jums labai, taip netikėtai žmogų pakvietėm kalbėti. Sauliau, man atrodo, Jums metas.
Well, it was unexpected for the person to take the floor. Now, Saulius, I turn to you. Could you summarize everything that has been happening over the past week? Yes, thank you, Laura. As always, you're able to inspire the audience, and I'm grateful that you have been so kind to join us in our events. And I do see it as my duty to make sure that the Parliament remains open to all groups of our society. And that the issues that are being referred to in the Parliament, that they are
being heard at the parliamentary level. As mentioned by advisor to the President, Mr. Moleite, the things that are happening in the parliament, the president's office or the government, they must be heard and echoed here in the parliament. Perhaps we would have liked to see more media coverage on this event, but we are aware of the rules of the game, those of the media as well, especially when it comes to this period of time for Lithuania. In any case, the event is being broadcast live, and the record of the event will remain for the future as well on the Seimas YouTube channel. It will be available or either its entirety or in excerpts. Have you subscribed to the Healthy Longevity Assemblies channel? I see some people raising hands. Since the channel has not been publicized that extensively, perhaps why not many of you have subscribed to it, but in any case, it also has video recordings of everybody's speeches made there as well. You will find there excerpts of individual presentations. In other words, if you were to recommend your friends or colleagues to watch any specific speech of this event, you will be able to access them on the said YouTube channel. So I would encourage to continue communicating this way as well. And as for today, we have said that the 20th century was the one where technologies helped us to prolong our lives. Nowadays, however, we see that if we speak about prolonged life expectancy, especially one that is accompanied with diseases, we will be forced to deal with a number of additional issues. Technologies and medicine are moving forward, but resources are not enough to make use of the available medical advances. So today we're faced with a tremendous challenge, that of adding not only years to life, but also adding life to years, as said today several times. As I speak here, being in the premises of the Parliament, I have to say that perhaps we should look into the existing safeguards for the elderly. Maybe some of them are grounded, others are less justifiable. Based on what we've heard from Ms. Nemanutė Gagė, on the one hand, we fail to use the opportunities provided by pharmacies and pharmacists. On the other hand, we have to be cautious about certain safeguards against lobbyistic activities. So perhaps we would have invited more companies and their representatives in our events, but we were cautious about the interest they would be representing. And we should not forget what Professor Badras has said, in that we should rely on reliable sources available in our scientific literature, because if that's not the case, we have a chance to dispute that. And as for priorities of ours, perhaps we should review them, and we perhaps should review our plans, our nearest plans for the future. So in the end, I would just like to reassure you that I will try to make sure that we have as much opportunities as possible to continue cooperating and communicating among each other to make sure that your voice is heard as best as possible. And I would like to leave with my last idea. And please make sure that you take care of the health of your close ones and be the ambassadors of your family members. And how we're going to do that depends on the abilities and skills of each and every one of us, as well as on the communities that we are members of. When it comes to our seniors, it should concern our younger generation as well. Some people may not like the word aging per se, but I believe that if we want to draw the attention of young parents, younger people, it is important that they come to terms with this word as much as possible. And since I did warn everyone that we should abide by our time limits, and I see that 5 o'clock is approaching closely, this means that we should move to the next room where we will have a chance for non-formal communication. We would now like to thank people who have already become the ambassadors of healthy aging. So once again, thank you for your participation.
Meeting next room.